to break the silence. Good morning, everyone. Thank you for joining us for the meeting of the Tulare County Board of Supervisors. We will begin today's meeting with the Pledge of Allegiance that will be followed by a moment of silence. We will be led today by yours truly. Ready? Salute. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you. You may be seated. All right, we will begin Board of Supervisors matters. Today we will start with Supervisor Townsend.
Hey, the microphone's already on. Mel must have known you were going to do that. Well, thank you. Good morning and happy Cinco de Mayo to everybody. Thursday was a Government Affairs Committee meeting for Porterville Chamber of Commerce, which I was not able to attend, and so thank you, Carrie, for calling into that meeting with the other reps and going over kind of getting information on state and federal elected officials, what's going on with them, what's going on with businesses around, and then Carrie was able to give a report on what we've been doing with the county, so I appreciate that. And Friday we were back over here for some interviews right here in A&B, and then May 7th, coming up this Thursday, is the National Day of Prayer. And so I think this will be the first time. Usually I've gone out and either spoken at an event or attended an event in the city of Porterville, and they're going to be having a call-in National Day of Prayer event. So they have several leaders from the community are going to be praying for this board and other elected officials, and they're going to be doing that on videos or on Zoom. And so be calling into that, and that will be good to do. And then later that day will be the East Tule Groundwater Sustainability Agency. We'll be having our meeting and talking about where we stand with our groundwater sustainability plans that have been submitted to the state, and doing some internal things that day as well. And that evening, I belong to the Fresno City College Advisory Board for the Architectural Department. My friend is the head of the Architectural Department there, so I've been doing that for many years. And also, this will be the first time we've ever done a phone-in call. And interestingly, he sent out an agenda, and it'll all be about, from the students' perspective, what's coming up for the industry, whether they're going into architecture, construction management, engineering, any of that. Just where do various professionals see that going, and what are the projections? And so they may actually tailor the last part of the year on their classes. They may tailor it to what is to be expected, because obviously whenever the economy shuts down for a while, you don't have disposable income, the construction industry will be the next thing to be hit. So that would be the architects, engineers, surveyors, and all the construction workers. So that'll be an interesting conversation on Thursday evening. And then Sunday the 10th, don't forget, Mother's Day. Thank you. That's all I have.
All right. Supervisor Valero.
Good morning, Tulare County. So I want to spend this time more as an informational, especially for those from District 4 that are listening and are still in need of support during these times. And so last Friday, the Rural Communities Resource Center, based out of Orosi, provided a food distribution event for the communities of East Orosi, and Cutler. They do this once a month via the support from the Central California Food Bank. One can truly see the need as cars were lined up along Road 130 and wrapped around El Monte Way, Avenue 416, well over 150 vehicles. These are trying times indeed for many families who've had to face changes and challenges as a result of COVID-19 experiences. I'd also like to share that Dinuba Open Gate continues to provide food assistance in the Dinuba area every Monday from 1 p.m. to 3 p.m. Moreover, Parenting Network is a new family resource center in Dinuba, just opened a few months ago. And that nonprofit agency is still open and available to help families in the Dinuba and Monson Sultana areas. They are working from home, but case managers are still out making deliveries weekly. Case managers are then doing assessments over the phone and doing what they can to get items needed to families. Currently, the FRC, Family Resource Center, is stocked on diapers, hygiene kits, cleaning kits, wipes, and they are getting food donated weekly from local grocery stores. I especially want to take time out to thank all of the organizations and agencies and individuals who are creatively mustering up ideas and projects to support everyone during this time of crisis. From graduation lawn signs to agencies gathering funds to support particular portions of our community, I thank you for the hard work getting done to serve beyond measure. And then lastly, and going along those same lines, for example, I had a constituent message me yesterday sharing that her father contracted coronavirus. Sadly, he's been at home since then in quarantine while his daughter lives and works in Los Angeles. Fearful and disappointed that she can't be near him during this time while he's alone in quarantine, she asked about services to help support her father while in isolation. And so right away, CSET was able to provide Meals on Wheels and resources to resolve this situation. So as we know, situations still continue to be dire for all of our communities throughout Tulare County. And lastly, I too just want to say happy Mother's Day this coming Sunday to all of our mothers out there who are, basically supporting, uplifting, and encouraging our families, especially during this time as well. And that is all I have, Chair.
All right, Supervisor Strickland.
Thank you. Last Tuesday, I made an HHSA video regarding COVID-19 and pets. I understand it's trending highly on Google right now. Also on Wednesday, I participated in the weekly Cal OES call with the Central Valley counties. It's again basically an update of what the governor's press briefing was that day, but it's also a good opportunity if we have any questions, and other counties sometimes ask questions that are pertinent, so we gain a little more information. On Friday, we had an emergency urgent meeting of the KT AAA to discuss the governor's Great Plates initiative. What that is, I don't know if you've heard about it, but the governor is working with local restaurants, encouraging counties to get meals from them for seniors. We needed to write a letter of intent to participate by yesterday at noon, and that's why we met. But unfortunately, there's a lot of information that we received that would not make it really fiscally feasible for us to participate. Should we want to participate for a 30 days, it's a 90-day program, for just 30 days, it would cost, they figured with the number of people who would want the meals, around $7 million. 75% of that would be paid by FEMA. There would be a 6.25% match locally, which is figured out to be about $450,000. But we would need to pay up front, and from the understanding of some of the folks that were on the call, such as CSET and folks who have worked with FEMA in the past and United Way, it takes about 3 years for FEMA to reimburse. So we just didn't feel that, we went ahead and said submit the letter of intent, because every day, it seemed like every hour, even on Friday, they were tweaking the program. So if people have heard about that program and we decide not to participate, that will be probably the main reason why. This afternoon, I have a mental health board meeting, and Friday we have our San Joaquin Valley Insurance Authority meeting, and that's it. Thank you.
All right, Supervisor Crocker.
Thank you, Mr. Chair. Last week, as well as this week, Woody Smeck, the superintendent of Sequoia Kings Canyon National Park, continues to have a weekly call just to provide updates. Last week, there wasn't a whole lot more to update, but specifically, they're having issues with, and it's been an ongoing issue, but it's something that's highlighted even more so, is the issue of housing for some of their workers, and making sure that they have access to rentals. And so that's been an ongoing issue, and that's highlighted even with what looks like a shorter peak season for the national park. Last Wednesday, also TCAG, we had a CERT review, which is a 4-year annual accreditation review through the Federal Highway Administration, and Mayor Bob Link, as Vice Chair of TCAG, was also, he and I both participated in that, providing feedback to the Federal Highway Administration on numerous aspects of TCAG, and that, I think that went fairly well. Last Thursday, PPIC hosted a webinar that I attended on Headwaters Forest Management. I don't know that there was anything necessarily earth-shattering. They just produced a small report on that, but the main gist of it is that when you're looking at larger scale projects for forest health and really getting some big landscaping projects, the successful ones have brought in multiple players, and or the larger the scale. And so some of the things that they did were getting water interests involved, really from the cost standpoint, and looking at what are the benefits to creating additional water, what is the benefits to having cleaner water that's going downhill into the flatlands. And so that's, Yuba County Water Agency was one that was looked at, as well as Placer County Water Agency. We have, Supervisor Valero and I, both a couple of years ago, met with Placer County Water Agency and Placer County and some of the things that they were doing. And so that was kind of the gist, is how do we get some of our local water folks to be involved in this process, help support our efforts of what we're doing, possibly providing some funding where they can show that there's a direct benefit from them paying for some of these forest health projects. Yesterday, RCRC had a special executive committee meeting via Zoom, and really just to go over some of the COVID-19 issues at a statewide level. Kudos to our CAO and to their Association of State CAOs. It was noted that they have been leading the charge on trying to get the $1 billion of funding that was granted by the federal government to counties of less than 500,000 and communities, cities as well, less than 500,000. And so there was some talk about the May revise, and the governor's plan might have some additional updates with that. But it was still, everything seems to be fairly fluid in that process. There was a lot of discussion as far as just hearing what the governor had announced just an hour or so earlier about what the implications were for other rural counties and what their plans were in place, and trying to get even regional approaches and trying to collaborate. And so there was some talk about some certain counties getting on the same page and having the same guidelines. I think that we're probably big enough that that's probably not necessary for us, but it was interesting to hear some of those discussions as far as what different counties were looking at. And as was mentioned, this Friday there is an SJVIA board meeting. That's all I have, Mr. Chair.
All right, thank you very much. A couple things I wanted to go over. One, I know that it's important during a time like this that we highlight efforts being undertaken and impacts being made in the communities by organizations that support our communities and support those in need. I know Supervisor Valero mentioned some in District 4. One of the organizations that has a tremendous impact in Tulare and in the Visalia area is the Salvation Army. I received a letter with some information detailing the efforts that they've undertaken. And since the beginning of the COVID-19 crisis, I want to just compliment them for this effort because it is truly impactful and a real accomplishment given the amount of staff and resources they have available to them. They have distributed or provided 1,637 food boxes. They've served over 6,062 people. They've distributed 173 cases of emotional and spiritual care, 13 delivery food boxes to seniors, and 276 miscellaneous items ranging from baby wipes and diapers to activity kits and sanitary items. And I just want to give them a quick shout out. I think that we often talk about a lot more of the high-profile organizations, at least in Tulare County. I would consider CSET with their wide array of services being provided to seniors, one of the more high-profile organizations, and I appreciate all the work they do. Self-Help has really stepped up to the plate during these times and is providing tremendous resources and services to the community. Salvation Army, Rotary clubs, food pantries, all these different organizations are finding a way to positively impact the community and benefit residents during a real time of need. And I think it's important that we as a county compliment them and thank them for the work that they do. This week, as was mentioned, we do have a San Joaquin Valley Insurance Authority meeting at 9 o'clock here in these chambers. Mother's Day is May 10th, and that's a special day, not for me because I'm not a mom, but my wife is with 3 children, and actually I just had a Star Wars type member of my family join yesterday. May the 4th be with my nephew. Parker James was born yesterday, and that was pretty exciting. We have a new member of the family, and didn't get to go see him at the hospital or anything, but saw a picture and look forward to meeting him in person sometime. A healthy child, healthy mother, so that's really what matters. So happy Mother's Day to all the moms out there, including my mom and also the mother of my children. May 11th, I'm not sure if we did, I think we did cancel the KTAAA meeting, but I did have that on my calendar. I wanted to mention it in case it was taking place. And then there's a Greater Cahuilla Groundwater Sustainability Agency meeting at 1 o'clock in Farmersville, followed by a Water Commission meeting. This will be the first Water Commission meeting we've had in several months. That will have a Zoom call-in option for those who are interested in participating that way, but I do feel it's important that we have that meeting and continue to move forward. That's all that I have for today during the Board of Supervisors matters. I will move on and take up item 2, which is a request to receive an update from the Health and Human Services Agency on COVID-19 status and response efforts in Tulare County. Mr. Lutz, trying a new microphone this week. You're switching one to the other.
Well, want to socially distance
Okay,
from...
socially distance from Mel.
Yes.
Hillary didn't care, but Mel does. So I'm glad you're maintaining that distance.
Well, good morning, Mr. Chair, members of the board, CAO, and council. My report probably be a little long today just because I have a number of topics that I wanted to cover, but I'll try and get through the first part quickly enough so we can have some discussion at the end. So unfortunately, I am reporting today that last week we did see our largest weekly increase in cases throughout this incident. As of this morning, we're at 858 cases, which is a 48% increase from the prior week, and also a 101 case increase from yesterday's numbers. The prior week's percentage, we were at 26%, and I'll talk about that in a little bit, but we were on a downward trend and then had that peak back up. Our deaths are up 5 from last week. Those have slowed down a little bit from last week's peak, and we're currently at 40 deaths. We do see increases in the recovered, up 51 from last week at 146. Our skilled nursing facilities continue to be a significant challenge. We are seeing and continuing to see strong increases. We do have 2 additional facilities that I'm adding to this report out from last week. For our summary, Redwood Springs, we are at 205 total cases. That's an increase of 22 from last week. And then on Lindsay Gardens, we have 99 cases, which is an increase of 59 from last week. That was our largest hotspot for last week. Linwood Meadows is at 12 total cases. That's an increase of 2. Dinuba Healthcare at 22 total cases. And then Sierra Valley in Porterville at 20 total cases. Over the last week, in response to these outbreaks, our public health staff, California Department of Public Health and CalMat have continued to provide support to the locations. We've shifted around some of the CalMat resources from initially the 2 Redwood Springs and Lindsay Gardens to a number of other facilities. Again, trying to make sure we're shoring up their staffing and being as flexible as we can. We're also working with CDPH on developing an assessment, a proactive assessment to gauge the facility's practices and thereby try and identify some risk of illness spread based on how their protocols are outlined and followed. We also saw sharp increases on some key business facilities in the county, Ruiz Foods being the largest. Last Friday, we partnered with Family Healthcare Network to do a large collection for a couple of their key production lines. On Friday, we collected 110 samples, and I would note the significance of those samples that we collected last Friday. We had just shy of a 50% rate of positives for all of those that were tested. So at this point, we're at 107 total cases in Ruiz Foods. 85 of those are Tulare County residents. The remainder are Fresno County. And then Central Valley Meat Group also, even though they are in Kings County, we do have a number of employees that reside in Tulare County, and thus far we're at 30 cases. Talking a bit about our testing and collection sites, Dinuba went live yesterday. Thank you, Supervisor Valero, for coming out and supporting the effort. It was definitely well received. We had a broad community support on rolling that out. Our staff are on site at Porterville this morning to also roll out that opening. Our hope being by the end of the day to replicate the success of getting Dinuba going and be doing some testing. I do want to acknowledge the great efforts for public health staff to proactively develop a plan at these sites. Given how this was rolled out from the state, when staff did their walkthrough Thursday and Friday and were talking to other counties about the testing, it became very clear that the infection protocols that were in place from the vendor and the state were going to be a significant problem for us, and in fact would probably be infecting a number of the staff and people coming in to get their collections. So we pushed hard to make a significant change from a walk-in to a drive-through, which mitigates significantly the amount of potential disease spread. It keeps the public and the workers at those sites safer, and hopefully will run people through faster as well. So definitely a lot of work over Friday, Saturday, and then into Monday morning quickly to get this going. The targets at those sites remain 132 tests per day per site, and we're happy to report that the sites will test asymptomatic members of the public. That was one of the areas that we were pushing on with the state to modify the testing recommendations with the goal of making this an open resource for the general public. Those collections are by appointment only. They can be made via a web portal or through the telephone. And that information we will be putting out. In fact, I think it already is out there on our website where people can call or go to the website. We also still reserve the ability to block chunks of time if we need to test a facility or a business and go through, do quick collections and testing. So talking now about our case trends, our positive cases, as I noted in the beginning, showed our sharpest increase on a weekly number this last week. Previously, week ending April 11th, we had 178 new cases. We felt, and then we saw the decrease. We were hoping that we were at a point of seeing this, this curve that would then start to show some decreases. So last week, when we got 225 as of May 2nd, that obviously is a significant concern point for us. When you look at our cases per day and look at the state's cases per day, both still continue to trend as an increase. On our average lows, where we'll see those 10s and 11s, we're now seeing 18s and 20s for kind of that low part before it spikes back up when a new round of people go through the testing. Moving on now to business reopening, and all of those prior pieces kind of fit into the discussion on business reopening and the governor's announcement yesterday, which was that beginning May 8th, the state is commencing with stage 2, or at least what they're calling a soft opening, in so much as not all of the businesses within the stage 2 category would open at the same time, and notably restaurants would remain closed to on-site dining. So what the state's proposal is modify the orders that would allow bookstores, florists, toy stores, shoe stores, sporting goods, jewelry, car dealers, among others, to start offering curbside pickup. The associated manufacturing and supply chain supports would also be able to resume production. And under that plan, offices, shopping malls, schools, and dine-in restaurants would be later in phase 2. The governor did outline a process for counties to accelerate through stage 2, and through that process, it would allow the local health officer to provide attestation that the county meets certain parameters. The details of all of those parameters are still forthcoming from the state. We did have a call yesterday with California Department of Public Health staff to discuss what some of the key metrics are. The information that we have is as follows. The first measure, and there are a few key areas that they're looking at, is the prevalence of COVID-19. And we must be able to demonstrate stable or declining cases and hospitalizations. I would note for Tulare County, hospitalizations have remained relatively stable. And our surge beds, right now we have no surge beds in active use. The caseloads, however, as noted before, have continued to increase. Our testing capacity, we must have a capacity to test 1 per 1,000 residents per day. And then we also must have a plan to expand to 2 tests per 1,000 residents per day. For Tulare County, the addition of those 2 collection sites in Porterville and Dinuba, we do have the theoretical testing capacity of the 480 tests per day to meet that first target. We would need additional testing collection sites, obviously, to be able to meet the second 2 per 100 or 1,000 residents per day. Another factor that the state's looking at, containment capacity. We must have capacity to do contact tracing for 3 times the daily positive cases. It's not entirely clear all of the factors that go into their metrics, such as average case loads for contact tracers and the such. So this one remains a little nebulous to us. It's also the one that poses the greatest challenge to us locally. The agency we're working through a variety of options to see how we can bolster our contact tracing, utilizing staff resources from other county departments, working with the Workforce Investment Board to assist on getting some placements for out of work or job seeking individuals, also looking at extra help recruitments. The state is rolling out a electronic curriculum to basically train up contact tracers quickly. We anticipate mid-May that to start to roll out to counties. And the state is also looking at reassigning between 5,000 to 10,000 state employees to counties. That would be a 6-month assignment to help conduct the contact tracing necessary. Fourth area, hospital capacity, and we must demonstrate the ability to manage surge of 25%. Not speaking for the hospitals, I would add that our hospitals have done a very proactive job at ensuring they have the necessary surge capacity, advocating for their resources. We do feel on our measures, this is where we are in the most comfortable area at this point, barring any significant challenges like having to evacuate a skilled nursing facility. And then for our vulnerable populations, we must also looking at our long-term care facilities, correctional facilities, homeless facilities, must have at least 14-day supply of PPE. And then we also must have sufficient testing capacity to handle outbreaks. We are looking a little more into this metric, particularly on the number of days for PPE. That can be a little challenging to assess per site, and we're trying to get as much information for each of our skilled nursing facilities as we can to adequately flesh out that metric. Closing from the governor's comments on this, some important points by this plan. The plan must be approved by a local health officer in collaboration with stakeholders and the Board of Supervisors. The plan would then need to be sent to the state where it will be posted publicly. However, the state is not approving those plans. And also an important distinction, this plan per the state's rules is for acceleration in stage 2 only. At this time, it would not permit a county to accelerate into stages 3 or 4. That's the final part for the governor's report out. I can go through the general statistics and then do questions if the board, okay. So quickly, Public Information Office activities. We had 35 media inquiries last week, 133 media reports for the last week as well. Our business liaison group had a little bit of an uptick in some of the calls, 131 calls, not surprisingly on a wider variety of business types that either are opening or complaints about not doing proper PPE. On our public health lab operations, at this point, we know at least 4,309 Tulare County residents have been tested for COVID-19 through May 2nd. That the important caveat there is that's the information we know from commercial labs. We don't get all of the negatives from commercial labs, so that number will be understated. Also of note, 22% of patients tested at the health lab are testing positive, 11% at commercial labs are testing positive. Overall positive rate is 17%. And then a note on PPE. Last week I reported that we were starting to see some more orders being fulfilled by the state. Unfortunately, just to show how quickly things shift around, we received no shipments from the state over this last week based on our order requests. The area that we are having some particular challenges right now are the gowns. You're seeing staff at facilities having to make modifications to what they're using for gowns to improvise, make things work. Again, the goal there to provide optimal protection on the disease getting on anyone's clothes or elsewhere being tracked home. For finance, based on Based on activity logs and tracking for incident, we're at $1.349 million with 304 employees in 6 sites. Moving now to our Coordinated Care Operations Center. Notable piece there for food operations, continue to work closely with FoodLink to address any concerns they have. They are foreseeing an additional need for staffing in the near future. And we have an existing agreement that we had worked with CSET on extending for CSET youth contract. It was renewed again with them, and we can continue to look at renewing that, but also looking for additional resources. Food scarcity is a concern for FoodLink. Right now, food orders are 4 weeks out. And then I would say that really concludes our significant items from last week, and I'd be happy to entertain questions.
Request from Supervisor Valero.
So I wanted to ask this question before I go into the others, and you had mentioned about the reopening based on the either the stability or the decline in cases. But will that be separated based on like skilled nursing facilities, given that that's kind of a big case right now for Tulare County, and then separating that between kind of the general public, or they're looking for a decline across county regardless of where?
You know, that's a great question, and one that we've been asking, because clearly the skilled nursing facility numbers skew our increases to a relatively significant amount. So we haven't gotten a firm answer on what the state's really looking at, whether they'll let counties treat that population separately. Clearly, they've contemplated the fact that skilled nursing facilities are a significant risk because of wanting the PPE, wanting the ability to do mass testing at those facilities. But there hasn't been a strong guidance on the metric they use if they exclude them or not.
Okay, thank you for that.
And Karen had something she
Okay.
wanted to add too. Go ahead, Karen.
And Tim is correct, but one of the, so the skilled nursing in terms of the total numbers, we can't really talk to that in terms of how they want us to look at it, but one of the metrics is for the vulnerable population that we have to have 14-day supply of PPE, and we have to have the testing lab capacity. If there's any outbreak at any of them, that we have to have that capacity. So that is one of the metrics in terms of what they discussed. That was the congregate living. That includes skilled nursing or any other assisted living or jails or whatever. That was one of the metrics.
Okay, awesome, thank you. Which then leads me to that question, is there a way to plan and provide expanding access to appropriate high-quality testing in congregate living environments and large places of employment, like the specific focus on skilled nursing facilities as mentioned, and companies, plants, or large-scale factories? Do you think we as a county do have?
So that's the primary goal, especially with the Dinuba and Porterville locations as initially conceived, recognizing that it kind of ebbs and flows. Sometimes we go a few days without a facility coming in, then suddenly we need, like last week with Ruiz Foods. It would have been great to have the Dinuba facility online then, because we would have just scheduled a day or two and had all of the staff go through that collection site. So yes, absolutely, that's a very important piece for us. One, to be able to do testing of workers at healthcare facilities, but then also workers at key employers like Ruiz Foods that are that critical infrastructure. In terms of the residents themselves, we would do something similar to what we did with Ruiz on an on-site. Now that we're developing that relationship with Family Healthcare Network, we could certainly work with them if we needed to go in and do testing of residents in that facility.
Okay.
At this point, it hasn't been a challenge for us to make sure that we set aside capacity. Our public health lab continues to try and keep some reserve ability to do testing quickly.
Okay, awesome. And then This is more of a comment than a question, because with the new Optum-served testing sites becoming available in Dinuba and Porterville, the question was going to be, will residents without symptoms also be able to get tested? And you said yes, the asymptomatic. And so again, just going to reiterate that even in a study with the University of Southern California, says that the spread of disease by asymptomatic individuals is a much higher burden than we anticipated. And so again, it's great that we are going to see a new level of testing and making sure that it reaches a broader people. And then a question that I have is, can our hospitals handle an increase in cases should our businesses begin to open progressively in the coming weeks?
And going back to kind of, I think that's a question to be able to also include the hospitals, but I will say we've had those discussions with the hospitals. We track those metrics on a daily basis, as is the state. At this point, we feel that our answer is yes, but there are some important caveats there, not the least of which, going back to if we had, for instance, the need to evacuate Redwood Springs or another large-scale skilled nursing facility, that would quickly eat up the available ICU beds plus the surge capacity beds.
Okay. And then last question, just being, do you think that there is a happy middle between residents who would like our economy to function again and those who want enforced metrics prior to reopening?
If there were, I would be a millionaire probably trying to put it out there. You know, that's a tough question, and I think it's the question that everybody across the nation certainly is trying to grapple with, is what is the in-between. You don't want to overwhelm the hospitals. Clearly, California was able to successfully avoid what New York turned into, which did overwhelm their hospitals. So somewhere in the middle seems to be the optimal range, but recognizing that the trade-off you have isn't necessarily that your infection numbers go up, because that is going to happen. We recognize that, but it's those unintended consequences of additional infections to the vulnerable population and the increases in deaths. So trying to negotiate or navigate what that trade-off is, I know is something that keeps a lot of us up at night, and unfortunately I don't think I have a good answer for you.
Well, no, thank you so much and that is all I have, Chair.
Okay, Supervisor Townsend, it's your turn.
Thank you, Mr. Chair. Thanks, Tim, for your ongoing work along with your staff and for the reports. Appreciate that. Couple of things, and I know this just came out. I mean, I was watching the press conference as well, so I know it's brand new. In the outline for the accelerated phase 2, it talks about the public health officer approval and the board approval of a plan, and then that plan will be submitted to the state, not approved by the state, but posted by the state with sort of a self-certification. And so our thoughts for the last couple of weeks, putting together some sort of a plan and getting everybody on board with a plan, and that's now shifted to basically doing the state's plan and proving that we can accelerate at a certain point based on the state's plan. But they're asking us to put together a plan, but it looks like the plan's put together. I mean, it was pretty specific what you outlined and what you had sent us in the email. I know they're going to send some more information on Thursday, according to the governor, but I guess if they've given us the plan already, it looks like we plug in our numbers to their plan and say, okay, what does 14 days of PPE mean here? You know, what does contract tracing mean, which is a nebulous one, as you mentioned. But what are we looking at? Are we looking at a timeline to submit a plan to the state now? I know the governor said, I'm going to give you all the information Thursday, and by the way, I'll start taking plans Friday. So at the end of the week, he's saying he's going to take plans, but we don't even have all the information yet. You've been able to give a little bit of an advanced idea. So who does the plan? When are we going to submit it? You know, what's our timeline for submittal? And do we approve it, As well as the health officer, is that what they're saying?
So, first, from our read, the health officer is the one who makes the attestation. We haven't gotten clear direction on does the board pass a local resolution as well, basically adopting that plan. We're still waiting for some of those nitty-gritty details of what that'll look like. In terms of what the plan is, there are really two pieces. The first piece goes back to what I think the state's really pushed, and that's the data-driven scientific elements. And that's basically the plan that I outlined that we got yesterday from the state, as you suggest. It goes through pretty concretely what key metrics we need to be able to show we're meeting. The second part to a plan, particularly if we were to say we're going to want to accelerate past what the state's doing, would be the plan going out to our businesses about what is allowable. For instance, curbside, are there certain restrictions? If we're now opening dine-in restaurants, are you saying the restaurants need to be at 50% capacity for their dining areas? So if we're going out ahead of the state, we also need to be laying out what the rules are going to be for the businesses within stage 2 to follow. And that's the CAO led a meeting yesterday with city managers and WIB agency staff to have an opportunity to kind of discuss what that framework could potentially be and whether we want to start to develop it. I think we got a good template from some other counties. Our perspective is, why reinvent the wheel locally if we can look at what others are doing and try and replicate a sound model? And that's what we're actively working through and developing. So there are really two key discrete elements. There's the data-driven piece, and then there's the operating plan for the businesses. Our understanding from CDPH yesterday is that businesses will also be asked to submit their own facility plan to local health departments. Unfortunately, we don't have to review and approve them per se, but we do have to have them collected and be able to evaluate, it sounds like.
Okay.
So that piece, our hope is, again, as we learn more through this week, to really line out our metrics clearly. And then now that we know our focal point right now is going to be businesses that are within phase 2, that we have concrete guidance that we can put out for the business community along those lines.
Okay. Yeah, and I agree, that would be the first one. And so then the second part of putting together the rest of the plans and getting something to the state, will we have enough information? I'm asking you to guess a little bit. Will we have enough information once we receive the direction on Thursday that we can set a time to turn around and give our plan back to the state? Will it take a week? Will it take 2 weeks? Do you know at this point?
To be clear, our plan at this point was not to submit any attestation until we have a firm grasp of the metrics and can come back and discuss where we're at. The feeling locally and going through some of those key points that I said, we know we don't have the adequate contact tracing measures in place, and we need to develop a strong plan to address that. That's one of the key areas we're attacking. We also need to start to look at how we would continue to expand our testing capacity and also address the safety concerns with our skilled nursing facilities. So right now, our focal point is really on how do we focus our energies to make sure we're meeting those metrics before we even really start to significantly contemplate the acceleration into phase 2 or stage 2.
Yeah, and thank you for that. And that's kind of why I asked the question too, is because when you look at some of the things, for instance, number one on declining cases, we're going to start quadrupling our testing. Right, with our Porterville and our Dinuba, we can do up to 264 tests. We've been doing about 85-ish. So we're going to now be doing a lot more testing, which logically follows we're going to get more positive cases. So our cases aren't going to decline as we increase testing. Other places that aren't increasing testing will see a more stable level because they haven't increased testing. So the more we do a great job of testing, the more our numbers are going to go up, and we're not going to be qualifying for some of these things. So that's what really bothers me about the plan, is that we're doing such a great job with testing and getting ahead of it that it's hurting us on the reopening side down the road. So what I'm wondering is, can we parallel path this thing where we really are planning for reopening and I mean, getting a plan in place that we can submit sooner than later, while in the meantime knowing that our statistics are going to, I think we need to address that somewhere, that our statistics are climbing because we're doing more testing. And then when we start to do we have to prove that we can do one test per thousand, so that's 480, so that's already almost doubling again what we're going to be starting as of today, and then to be able to expand to 2 tests per thousand. So it seems like we have to be thinking about it and acting on the planning side at the same time that we're trying to verify and quantify the metrics, I guess is what I'm saying.
And I have 2 points to address on that. You're right, the challenge is the more testing, going back to our positivity score, at this point, we're seeing 17% of those that are tested are coming back positive. So we would expect, if that trend continues, that we would see that 17%. Our public health lab has been at 20, so I think that's a good range to look at. But I also think the state, particularly in that metric, when they discussed it yesterday, and again, we're still waiting for the concrete information, married the increases in tests with the hospitalization numbers. And I think going back to what Supervisor Valero's question was about some of the asymptomatic individuals, is we might see an increase in positives, but if we're not seeing a corresponding increase in hospitalizations, uses of ventilators, those are some key things to be keeping track of together as opposed to individually. Individually, the hospital numbers look really good. Individually, the caseload numbers look really bad. But I think the two have to have an interplay, and that's what we'd be looking at. And I think you're absolutely right on a parallel path, which is why I said our goal right now is our focal point for what we're really aggressively pushing is making sure that we're trying to address what those requirements are going to be, but we want to have that plan in place so that we can start messaging it. I mean, a prime example for even Health and Human Services, anticipating that at some point offices are not yet in that open phase for phase 2, but anticipating that we're going to be open, we're already putting together some safety measures such as plexiglass barriers, things like that. So we recognize businesses need to be able to also plan for that. So as much as we can run with a parallel path of providing the guidance of what things will probably look like when we get to the other side of this, the better, and we are trying to do that.
Thank you, Tim. Appreciate it.
All right, Supervisor Crocker.
Thank you, Mr. Chair. Tim, appreciate another great update. One note, I know there was mention as far as whether or not the board needed to weigh in and take action on a reopening plan. On the RCRC Executive Committee, this was brought up, and I'd be happy to send staff contact information for their general counsel as well as their staff. But based on what they have seen and comments, staff was stating that they thought that each board would need to take action for some type of plan. So with that and understanding all and recognizing that there's still a lot of moving parts and there's shifting targets, but I think it's not so much a question as really an ask that we need to really work on developing a plan. We know that we have some areas where we need to focus on and try and, you know, get ahead of this as soon as possible. So, you know, having a plan in place to expand to 2 tests per 1,000 residents, you know, that's something that we know we can be, you know, if it's not being worked on, then working on that. Working on the PPE issue and having plans in place and looking at things, you know, recognizing that the state has outlined issues, but also that they're not approving or denying any of these plans. So if we're comfortable with the plans, then I think we need to be ready to say, we've got things moving forward, we're gonna need additional assistance, we're going to need support. Yeah, we understand that businesses are gonna have to make adjustments. This isn't just a free-for-all, but something that says, all right, let's get the ball rolling here, then that's something I'd be supportive of. And granted, this is, you know, how quickly that would happen, you know, I would love to be able to you know, have something where we could call a special meeting on Friday, and say, you know, the guidelines came out from the state, we made a few adjustments to the plans that we've already created based on new information, and we could, you know, move forward with looking at, you know, giving some surety to businesses, because I think that's a discussion we've had. That's really, I think, the key thing is that these business owners are, you know, they're in the dark, and they need to have some type of constant. And if we can be that point where we can say that here are the rules, this is what you still have to do, you know, some additional measures, you still have to have social distancing, we still have to, you know, even if it means, you know, we're going to only focus on these areas and we'll have an update next week or something, or you know, I mean, we could do it where it's phased just because of, you know, the timing. We don't have the ability to look at a holistic approach. I think that would even be preferable than to just wait until we had all the information. But based on what we have, try and get out as much as possible and move in that direction. That's something I'd be very supportive. And I know you guys are working hard on trying to develop these and make sure that we're still keeping everyone safe. So I recognize that, and recognize that that's some of the you know, the balancing act as far as the competing interests. So that's just my 2 thoughts.
Actually, it was more than 2. Supervisor Shuckley, I'm kidding. Thank you for your comments.
Well, actually, I was going to kind of say what Kyler said yesterday after the governor's press conference. CSAC Board of Directors called an emergency or urgent phone conference, and there was a lot of discussion about this. And that was really a point of clarification for a lot of folks, that once these plans are, you know, turned into the health officer and attested, then it does need to go back to the board. And I was talking with our board rep that we may need to have an emergency meeting. We may not be able to wait till our next meeting. If this falls in between meetings, I think we need to be prepared to act on it immediately.
All right. I appreciate the comments of my colleagues. First of all, I just want to say thank you, Tim. Again, I've tried to reiterate at every single opportunity that you've given an update. Thank you to you and your staff for the work you're doing. I know that it is a tremendous undertaking getting through this pandemic, and your staff is to be commended and complimented for the work that they've done. I do agree with what my colleagues have mentioned. I think it's very important, you know, if the guidance comes out on Thursday and says, okay, starting tomorrow, you can begin to move into phase 2 or stage 2. I'm ready to have a board meeting at 8 o'clock in the morning on Friday before the SJVIA meeting to make sure that we're open to our businesses that qualify under stage 2. I think it is absolutely critical that whenever we have the opportunity, we aren't saying, okay, well, Kings County's here, Kern County's here, all these different counties are leading. I don't want to be behind looking at them. I want to be one of the first, if not the first county that opens up. But I also want to make sure that what we include within our local plan is protective of the vulnerable populations because this is a very serious illness. very serious virus that needs to be taken seriously. But what we have done as a state, and in some cases throughout the country, is we've shut down everyone. I don't believe that as we reopen, we need to just reopen everything carte blanche without protection for those who are vulnerable. I think it's important to protect those that are most vulnerable because this is very serious. But at the same time, we have to get this thing open. I mean, I get calls from the Tulare Chamber of Commerce and businesses in Tulare. This is just devastating. You know, there have been programs of assistance coming from the state and federal government. I don't know that many of the businesses that have been calling me asking what they can do and how quickly they can get reopened, I don't know if they're going to be able to reopen. You know, we sit here and we continue to count the number of coronavirus cases. Have we done a count on number of suicides or, you know, different things that have been suffered? I know you can't do that, and I know there's a lot of constraints, but I just really believe there have been such catastrophic impacts to society that we really have to be at the forefront in returning to full operation within our society while protecting those who are vulnerable and susceptible to the coronavirus. So, you know, I know that we have a later item on our agenda that's going to be a hiring freeze if it's approved by the Board of Supervisors. I will lift the hiring freeze if that means that we can get our county reopened, because without businesses open and serving members of the public and serving consumers throughout the county, we lose additional revenue, and the hiring freeze is going to be even for naught, because we're not even going to have money to operate as a county. So we have to find a way to get open, do so responsibly, and to be a leader amongst not only the San Joaquin Valley, but also in the state of California. I want Tulare County to be there. So a few comments I had, and Supervisor Shuckling would like to comment.
Yeah, I think we also need to be aware, have a plan, and be able to say, whoa, we need to pull back maybe if anything were to happen. We start seeing a spike in certain areas, retail or whatever. So I think that needs to be part of the plan, and we need to be open to that. Hopefully we don't have to do that, but that needs to be part of the plan.
All right, Supervisor Townsend.
Oh, Mr. Chair, I just wanted to mention real quickly that what the governor said was this Friday is stage 2.
Yeah.
Phase 2 with, you know, with that's opening of certain businesses, with the retail businesses, manufacturing with restrictions. So we are actually there where the governor has said do it.
Yeah.
And so now it's a matter of us providing that guidance.
That's what I mean. So you know, if opening business is 8 o'clock Friday morning, we're going to be ready there at 8 o'clock Friday morning to reopen. Yeah, so that's just making a general point.
Thank you.
So thank you.
A great point in terms of, yes, come Friday morning, the county, the health officer, the way that it's written, the stage 2 initial businesses, those retail shops, curbside delivery, they can reopen. It's the restaurant, dining, schools, offices, those types of facilities that would be the accelerated option if the county passed the local attestation and the health officer signed.
Yeah, but sorry I didn't include the terminology. That's where I want to be. All right, that concludes that item. Thank you, Tim. Again, appreciate all the hard work that you are undertaking. Thanks for the short presentation, too. We'll move on to item 3, which is public comments. At this time, members of the public may comment on any item within the jurisdiction of the Board of Supervisors, but not on today's agenda. Public comment can and will be limited to 3 minutes. We have a member of the public who's already at the microphone. Before I even finish, Ms. Montero.
Good morning, Supervisors, CAO, County Council. Carrie Montero, Board Representative to your board, and also, as you know, the other duty assigned is serving as the County Public Information Officer. I wanted to provide some brief comments today to update you. On April 22nd, we launched a new county website, and it was the Tulare County COVID Response webpage. The new site address, those of you that may know, it launched on April 22nd. It is www.covid19.tularecounty.ca.gov. For those of the public listening on the phone, if you're unable to catch that web address, you can simply go to our Tulare County main page at tularecounty.ca.gov, and on the top banner will link you to our new response website. We saw as this pandemic moved beyond the public health scale, there was a wealth of information amongst our county networks, as well as our statewide networks and federal partners. So we saw a need for a simplified one-stop shop for our residents to find the latest updates, information, and programs available to them. So I wanted to share with you publicly, this is the new site. It is live. We have our local health orders posted up here, which we're going to be posting some updates here shortly. We also have a dashboard providing all the latest statistics from our public health department on new cases, which is updated daily, as well as the regional map showing cases. One area that we also have is our local curve and showing our active cases as well as our confirmed cases and further statistics up on our dashboard showing how Tulare County is trending in deaths, in contact, and cases that are under investigation. Below the dashboard, we have more information regarding just what we're discussing here today. It includes access to our public health guidance. It includes access for business resources, housing and rental assistance resources. We partnered with our Workforce Investment Board to link to their site for workers and employment resources in the county. We also added just recently the COVID test collection sites. So we were able to work with our public health department in getting a full list as it loads here of all the collection sites in Tulare County. We also will be adding a map portion to this, but this is a one-stop shop for residents to know who is testing in the county, where are they located, and who they need to call to make an appointment to see if they qualify for testing. That also includes our 2 new sites that we are launching in Dinuba and Porterville this week. Also, this provides us an area to provide the guidelines of reopening. Currently, we have on there a small page of how we're working on the plans, but this can also serve as a tool for us to inform the public of those plans when they are ready. Currently, right now, we have some information up there helping folks understand the various 4 stages of the state for reopening that we are working at. So this site is available. It's a great public information source that we have for our residents, and it will continue to be updated and changed to fit the needs of the current situation, as well as to fit the needs in recovery. We have been working with a coordinated care effort at HHSA to provide information as a one-stop shop for all the recovery programs and services available in the areas of food resources, in the areas of mental health and emotional support, as well in the areas of Tulare Works and WIC. So we can always change and adapt and make this as a one-stop tool for our residents as we move forward in this new website. Again, covid19.tularecounty.ca.gov. I wanted to show that to you as well as here publicly for everyone listening in Tulare County. And in closing, I want to give thanks to the many county staff who played an effort in making this website and new tool available, including the TCICT web design team, including IT's GIS mapping team, the county public health branch and their operations under the epidemiology, as well as the public health emergency preparedness staff, all assisting us in coordination with the county's Joint Information Center to get this one-stop shop source website up and running to give the people of Tulare County the latest information regarding to COVID in terms of health updates, in terms of reopening plans, and anything else that we need available. Thank you.
All right, thank you. Are there additional, okay, we don't normally respond to public comment, but go ahead.
Just a comment. First of all, thank you, Carrie, and thanks to all of those folks that you mentioned that are involved in this. I think with this current issue that's going on, the COVID-19, there are so many unknowns, and to have a place where people can go to get some answers, and especially local answers, is so important. And I also want to commend you in the job that you've done, you know, taking over at the JIC and being a part of that, and also, you know, keeping things going here at the office. So thank you.
Supervisor Valero?
I don't know if it could be shared now, but I should have stated it earlier, and so maybe later you can address this, but I have been getting questions with regards to the charge and whether or not it's kind of an insurance for each individual case, or for those that can't or don't have insurance, how do they get tested? And again, I apologize for asking it now, but it reminded me when you said sites for testing.
So, sorry, yes, if there's an insurance source that they can bill to, they will bill to it. If they do not have insurance, the state is covering that cost. So there will be no charge to the person getting the test or the
Okay.
collection.
Thank you.
All right. Thank you very much for the comments and questions. Madam Clerk, it sounds like we have public comment on the phone. Is there any other public comment here in the chambers? First, okay. Mr. Washington, would you like to make a comment? Please come forward. State your name and address for the record.
Thank you, Chairman and Supervisors, County Council, and Mr. CAO, Dr. Britt. Mike Washam, Tulare County RMA Associate Director. I'm here today to just talk a little bit about tourism. 2 months ago, we were planning to roll out the annual Visit California Tourism Impact Report, and we were hoping to do it at the Darling Hotel as part of their opening, and we had that all planned, and then COVID hit. So it's a different world. So yesterday they released the Visit California Travel Impact Report for 2019. So these numbers don't have any impact for COVID. I'll talk about where we were, where we were headed, and what's anticipated now. So briefly, in 2019, California saw another record-breaking year, surpassing $144 billion in travel spending, supporting 1.2 million jobs and driving $12.2 billion in state and local taxes. So what does that look like in Tulare County? So in 2019, Tulare County saw also a record-breaking year, surpassing $541 million in travel spending, supporting 5,527 jobs, and driving $49.5 million in state and local revenues. That would be $17.4 in local taxes and $32 million in state taxes. Tulare County travel spending has been growing on an average of 5.4% over the last decade. Job growth averaged 3.2% a year during the same decade. And in 2019, the local industry created about 145 jobs. New jobs. And then travel-related tax revenue has been averaging a growth of about 6.5% per year for Tulare County. And then COVID-19 hit. So it's really devastated the California tourism industry, erasing more than 10 years of growth. According to the Office of Tourism, they're expecting to see a $72 billion loss in travel spending in 2020, with about 50% of the workforce, 613,000 workers losing their jobs by the end of this month. So how does that scenario look in Tulare County? If those numbers play out in our county, Tulare County could expect to lose $270 million in travel spending, including 2,750 workers losing their jobs, and an estimated reduction of $8.7 million in local tax revenue. So as we're talking now about recovery and reopening, tourism is one of the most labor-intense sectors and creates jobs faster than most other sectors. When it gets going, it kicks up faster. When it drops faster. It's been very resilient. It took 2 years less to fully recover from the Great Recession than most other industries, so it has that ability to bounce back. The state is optimistic about international tourism will bounce back, but I personally think that is going to take a lot longer. People really won't be ready to do non-essential leisure air travel. I think what's going to happen is people are going to avoid theme parks, avoid cruises, avoid going to those sporting and concerts. If or when they open, there'll probably be reluctance to go there. However, I think what we have in our county is our natural resources. I think visitors will look to go to our parks and lakes, our golf courses, other recreation, outside recreation things, our national forests and the national parks. So with that said, I think we could have a very good bounce back in Kings Park, or Kings and Sequoia National Park. The visitor breakdown is about 20% international, 15% come from other states, and the remaining 65% come from California, somewhere that you can drive to without having to take an airline. So really kind of anticipating that numbers are going to really spike. Some reports of people in the Forest Service having to kick people out of campgrounds that are closed already, and there's a lot of pent-up demand to get up into the mountains. So I think we're going to see a good bounce back for our economy. We don't have the theme parks, we don't have those high density types of venues, but we have a natural social distancing in our forests and our mountains. So I think we'll be able to bounce back on that. So we're working with the Sequoia Tourism Council. Like I said, we were planning to have this grand release of this report, but we're looking to probably do a presentation to the city's group probably in July to talk about what we're looking at, what the real results of this have been, and how to go forward. We're already planning to go forward to revitalize our local economy in the tourism industry. And with that, thanks a lot.
Thank you, Mike. Appreciate your comments. All right. Any additional public comments from members of the public here within our chambers? All right. Seeing none, Madam Clerk, I know we have some phone comments.
Yes, and I also have a public comment to read into the record that was sent. It states, Tulare County businesses, we have been through a lot together. We have faced freezes and floods, recessions and downturns, bull markets and bear markets, and now our first global pandemic. Through each of these challenges, the Tulare County economy has come back, more resilient and fruitful. Economic indicators and forecasts show that the resiliency of the Tulare County economy will allow us to thrive and prosper when our operations return to the new normal. We recognize that some businesses may close permanently, and others may have a hard time assessing the supplies and services they need to fully reopen. However, we also know that the entrepreneurial spirit that exists among us all will continue to drive us to new opportunities and new ventures. Our message to you is twofold. First, don't lose hope. Businesses will reopen, consumers will spend, and our economic conditions will improve. Second, focus on the future. We will all need services and supplies to reopen and operate our businesses. Start planning now for what you will need or what you may have that you can share with others. If you can't find what you need, let the business success team at the Tulare County Economic Development Corporation know so they can help you procure what you need. Over the days and weeks to come, our task force will be focused on ways that we can assist your businesses and renew our economy in Tulare County. Working together and supporting one another, we will enjoy prosperity and economic renewal once again. This is from Tulare County Recovery and Renewal Task Force.
Thank you. Next public comment.
Good morning. Thank you for holding. You are now connected to the board meeting. Please state your name and address for the record. Your 3 minutes will begin now.
Teresa Figuereta, and my address is 455 Cottonwood Street, Lindsay, California, 93247. Good morning. My name is Teresa. I'm an in-home IHSS care provider in Tulare County, and my coworkers and I believe that we deserve it, that we do for the elderly and the disabled people in our community. I also want to add that about, if you guys can consider health insurance for some of the providers. So please put IHSS as a priority in the Tulare County, for Tulare County. Thank you.
Thank you.
Thank you. Next public comment?
Good morning. Thank you for holding. You're now connected to the board meeting. Please state your name and address for the record. Your 3 minutes will begin now.
My name is Michelle Bejarano, 22635 Carson Avenue, Exeter, California, 93221. I have worked with in-home supportive services for 20 years, and we have never had any type of health care coverage. Our pay has always been lower than anyone else, and yet we are mainstream for people who can't get out and can't take care of themselves, and we get underpaid, overworked. We can't get benefits to take care of ourselves and our families. We finally got a union to help us, and I feel like we're still missing out. I would love for one of you Board of Supervisors people to come and spend a day in my shoes with my client. He's on board with it, so you can see just how we help the people in our community. I don't know what else to say, but we need a little bit more help from our county and our state. I have to be on Medi-Cal just so I can go to the doctor or the dentist. And right now it's especially difficult because I can't get seen. I have a broken tooth. I can't take care of my medical concerns, especially because of COVID, unless it's an absolute emergency. And my client is very immune compromised, so I can't really go out and do any of the basic things I need to do. And, I struggle. I struggle to pay my rent. I struggle to pay my bills. I think that us as American people, we can do better to help everyone, each other. I would like to see a small wage increase would be wonderful. I know that Fresno has a higher pay scale than we do. I also know that they have a medical coverage plan for their in-home care providers. That would be wonderful if something like that could happen for us so that we can take care of ourselves, to keep taking care of our community and the people that need us. We don't do health care because we want the money. We do it because we care about people, and we think that everyone should be treated equally and fairly and have the best care possible. I would want someone to do the same for myself. I would hope that you also feel the same way. I don't know what else I can say, but that's my hope, that we can get better services for providers like myself.
Thank you for your comments.
Thank you for listening.
Good morning. Thank you for holding. You're now connected to the board meeting. Please state your name and address for the record. Your 3 minutes will begin now.
Yes. My name is Estela Ibarra, and my address is 194 North Kinby Street in Tulare, California, 93274. Yes, I'm a care provider in IHSS. We're underpaid while raising our lives, taking care of our elderly and disabled people in Tulare County. We need a wage increase in health care insurance. Please think about IHSS care providers since we're essential workers and exposed to COVID-19. Thank you.
Thank you for your comments. Madam Clerk, do we have additional public comment?
Just checking. Yes, we do.
Okay.
Good morning. Thank you for holding. You're now connected to the board meeting. Please state your name and address for the record. Your 3 minutes will begin now.
Hello, my name is Nicole. My address is 326 West Alcorn, Tri-State, California. And I'm an IHSS care provider in Tulare County, and I work very hard, and I deserve a wage increase. I put my family at risk while working in IHSS, taking care of elderly people. I am working with no health care insurance at my job, and that scares me. Please think about IHSS workers. Thank you.
Thank you for your comments. Madam Clerk, do we have additional?
Yes, we do. Good morning. Thank you for holding. You're now connected to the board meeting. Please state your name and address for the record. Your 3 minutes will begin now.
Yes, my name is William Baker. I live in Visalia, California. My address is 2104 South Maselli Street. I've been a care provider through IHHS and a union member for about 3 years now. And several issues I'd like to bring up. One, is it possible for part-time workers to get insurance? Me and my client, we get a total of 98 hours a month, and I split that between me and my spouse to take care of things. That would be one question. And one is, can we get personal protection equipment at our union office, like, say, hand sanitizer? It would be a good thing to be able to get that in an emergency if something like this happens again. And it also brought to my attention that people are getting paid to go from one client to the next. I believe that should be limited to the number of miles in between each client. That being said, I have to go to my client's doctor's appointments, and because of his capacities, I need to be an advocate between him and his doctor. So I would believe that we are getting paid to travel from his house to the doctor's appointment, but I think it would be pertinent to at least have some time allowed for the doctor appointment itself. As far as wages, you are going forward with being consistent with California. As a care provider, we are the only people that are stopping or helping our clients to stay in their household because not given the care that we provide, they would not be able to live on their own. I do not live with my client, so it is a different situation. This is basically the main ideas that I have, but I am, like I said, been working with IHHS for about 3 years, and I appreciate your time, and I would appreciate it if the Tulare County Board of Supervisors would take IHHS
Thank you.
Mr. Chair, that was our last call.
Okay, seeing the end of public comments, we will now move on and take up our consent calendar, items 4 through 12. Are there any items that board members would like to have pulled for separate consideration? Members of the public? Okay, seeing none, the chair will entertain a motion. I have a motion by Supervisor Valero, second by Supervisor Shucklian. Please vote. Motion passes 5-0 to pass the consent calendar as presented. We will now move on to the untimed portion of our meeting. Take up item 13, which is a request from the fire department to introduce and waive the first reading of an ordinance repealing Article 3 of Chapter 5 of Part 4 of the Ordinance Code and replacing Article 3, Chapter 5 of Part 4 of the Ordinance Code pertaining to fireworks displays. Chief.
Good morning, everyone.
Good morning.
Mr. Chair, Vice Chair, CAO, County Council. Good to be back. It's good to be seen. We'd like to go over this ordinance rewrite. Congratulations on Parker James. You know, may the 4th be with you in front of Cinco de Mayo. I went home last night and we had Darth Maul molten lava cake and Death Star Oreo truffles. So that's why I'm so slim. So, always good to find levity in these very unique times. So it's just, and we're having to look harder and harder each time. And with that, that brings us up to my favorite day of the year, the 5th of July. So, we looked at our ordinance rewrite, we looked at making a couple of small amendments, and it ended up being a rewrite and repeal. So going through that, the crux behind it was to make it more enforceable, going from June 28th to the 4th, instead of working beyond the 5th. There was one issue that we had with a vendor, just talking with them. The issue since the agenda was published, was discussion with one of our vendors on the 501c3 exempt status, and we left out inadvertently the equivalent tax exempt status. So we changed that on section 4-5-1080, the eligible nonprofit organizations, to include equivalent tax exempt status from the Franchise Tax Board. So that seems to appease everyone. Just kind of a brief review, and again, I'll try and keep this very brief. With this, there's not going to be a lot of change into it. The majority of the sales, probably 90% of the sales, occur on July 3rd and 4th. We do have that period. June 28th puts us in compliance with 12.599 of the Health and Safety Code. In previous years, 2019, we had 32 booths. 2018, we had 35 booths. In the world, according to Charlie, I'd like to see everybody go to public shows. With our new pandemic, that is probably not happening to a great deal. It is a great fundraiser for our nonprofit organizations throughout the county. With the 4th of July being on a Saturday this year, that means we're going to have activity on the 3rd, 4th, and the 5th. So it's going to be extensive, that coupled with the public shows. Most of the shows are up in the air or canceled. I'm waiting for Tulare Kiwanis show, which we don't have jurisdiction over, but they're going to meet tomorrow on that. And then Exeter, they usually have a big fundraiser on May 2nd that funds their show, AKA Brewfest, and they did not have that this year, so they're looking at some community donations to make that show happen. July 4th, 2019, we had 19 fireworks-related fires, mostly grass and roof fires. One fireworks-related injury was an eye injury. We issued 14 citations at $1,000 apiece for admin sites. And we had 2 arrests for 752 pounds of illegal fireworks. Very sadly, City of Visalia had 1 fatality due to a structure fire with bottle rocket hitting some palm trees and causing the fire. Fines are $1,000 for illegal fireworks. Anything, basically, rule of thumb, east of the Frank Kern Canal is illegal, whether it's safe for saying or illegal fireworks. And so we wish everybody is safe and sane. I would answer any questions. I have Chief Marcus, Chief Riggy, and then I think I have Jennifer Schiffert that's stealth on the phone. So I would answer any questions and ask for your first reading of the ordinance today.
A question from the firework expert, Ms. Amy Shucklian.
Thank you. I know last year we discussed this and how our sales, went past the July 4th, so I just want to say I appreciate the work that all of you have done to redo this ordinance and to make Tulare County safer. Thank you.
Thank you.
Any additional questions or comments? Thank you, Chief, for bringing this forward. Madam Clerk, do we have any public comments related to this item?
One moment. Nope, looks like we're good.
Okay, no public comments. Thank you very much, Chief. We appreciate you coming forward with this and always appreciate your efforts to make Tulare County safer. Much appreciated.
Have a good day. Thank you.
All right. Yeah, we do need a motion at this time.
Second?
We have a motion from Supervisor Crocker, a second by Supervisor Shucklian. Please vote. Motion passes 5-0 unanimously. Next, we're going to take up item 14, which is a request from the County Administrative Office to approve a hiring freeze of existing vacant positions and future vacancies effective May 8th, 2020. And I will let you fill in the rest of the detail.
Thank you, Mr.
CAO.
Chairman, members of the board. Not an easy subject to discuss, but nonetheless, we have found ourselves here. The coronavirus public health emergency has caused an abrupt halting of economic activity and massive job loss. The Legislative Analyst's Office for the State of California has declared it is clear that we have entered into a recession. The effects, significance, excuse me, the effects, significance, and duration of this economic downturn is still unknown. As such, I'm anticipating a significant loss and or deferral of sales tax revenue, which makes up about 25% of our discretionary budget revenues. Sales tax, it's also important to note that sales tax also funds our major realignment programs, 1991, 2011, AB 109. In addition to sales tax revenue loss, the state is allowing businesses to defer sales tax payments, and at this time it's unclear really what that means for the county's budget, because we're not certain how many businesses are going to choose to defer, how many are not going to defer, and whether or not they will actually end up paying those taxes later on down the road. Additionally, we are, at this point, we are not clear if the state will be backfilling those deferred sales tax payments. I know there's a lot of advocacy and pressure on the state to do so, including, as mentioned earlier, the county administrative officers of the state sort of banding together and writing a letter to the governor. That's one of our requests, is to backfill any deferred sales tax revenue. But it's not clear. So the lack of backfilled tax payments, sales tax payments, puts further pressure on what's already a strained budget due to this global pandemic. Just some other issues contributing to the budget strain are the response costs to the coronavirus pandemic. We are, as Mr. Letts mentioned this morning, we are at $1.3 million and growing. And I suspect that will continue to grow as we are in a sustained response period. Even though we may talk about recovery and make steps towards recovery, I think we'll continue to be in sort of that space for quite a while. There's also the lack of coronavirus assistance to counties and jurisdictions under 500,000 population. It is still very unclear whether the state will pass on any of that money that they received from the federal government to smaller jurisdictions. Just to give you a brief example of what that means to Tulare County is Stanislaus County, which is roughly 550,000 population, so not too much larger than Tulare. They're expected to receive somewhere around $96 million. We receive nothing. So this continues to further strain the response and the cost associated with those. And then I anticipate that there will also be new and increased costs for operating in sort of this COVID environment for an extended period that we have yet been able to quantify. Some examples of those potential increased and sustained costs will be hiring of contact tracers. If that's one of our metrics to reopen the economy, we're going to have to look at redirecting staff or hiring individuals, and that will come with a cost. And it's equally unclear that although this is in essence a mandate, whether or not we will either receive any reimbursement or funding for those positions. Eventually, we will reopen business to the county as well in terms of our lobbies. Many of our offices have been closed to the public through this pandemic, and that will come with increased cost of janitorial because we will need to increase the frequency and a number of times per day that we clean, how we sanitize. So there's still a lot of those types of issues that we are working through, but we really do see sort of that area being another potential cost. And then depending on job classification, there may be a need to continue to provide protective equipment to staff who go out in the field for a sustained period of time, and that as well comes at a cost. So although the county has sufficient or at least budget reserves, it is unlikely that they will be sufficient to continue to do business as usual until the economy recovers. The county will need to take a multi-pronged approach to weathering this downturn, and one of those tools to weather this downturn is the use of a hiring freeze to help reduce expenditures. Based on a survey of HR directors in mid-April, a number of counties have either implemented or considering a hiring freeze. Those include our neighboring counties of Fresno, Kern, Kings, and many others throughout the state. Just to give you a sort of a picture of the type of revenue loss that we're expecting, we sort of look at these things in a moderate or severe category. And so right now, to give you just a range of what we're expecting based on these are estimates based on the best data available, and I want to commend my staff along with Cass Cook's staff, who's our auditor controller, in helping come up with these numbers. But just to give you an idea of the type of financial impact we may be sustaining as a county is for discretionary sales tax. So that's that 25% that helps to fund our programs. This also includes the Prop 172 public safety sales tax numbers. We are looking at somewhere between $7 and $10 million in reduced funding this fiscal year, meaning the fiscal year ending June 30th. We haven't even begun to look at what the numbers might look like after July 1st. If you add the 1991 and 2011 realignment, along with the AB 109 realignment, that in of itself is 12 to 15 million. Adding those two together, it's $18.7 to $24.9 million in potential revenue and or deferral payments. Between those two, deferrals and loss of revenue, that makes up those numbers. And then if you add our projected COVID-19 response costs, we are looking at an estimated budgetary impact of $21 to $27 million, whether this is a moderate or a severe downturn. So the numbers are staggering. We are hoping that perhaps the revenue will come in better than we're projecting, but that just sort of gives the board and the public an idea of sort of the reasons we're making these decisions at this time. Because for our county, a county of our size, where our discretionary revenue is, we spend every dollar, having a $7 to $9 million, $10 million hit is a significant issue for us. And again, these are what we expect to be reduced in payments to us this fiscal year ending June 30th. So finally, in this uncertain time, it calls for approaching also our fiscal year 2021 budget with the utmost caution. The state legislative analyst is recommending that the state recommend with a baseline budget for next fiscal year until we have better data and information of the true economic effects of this public health emergency. So based on all of this, I'm recommending to the board that we institute a hiring freeze to assist in cushioning the blow of significant anticipated revenue shortfalls for the last quarter of fiscal year 1920 and for fiscal year 2021. That concludes my report. I'd be happy to answer any questions.
So a question that I have, Mr. CAO, obviously one of our, I think the most prioritized task here at the county is public safety. Would you please comment on your thoughts as to the impact of this hiring freeze to our public safety departments?
Sure, thank you. I mean, public safety is a priority for this board. We certainly do not want to do anything that's going to jeopardize putting cops on the street or investigators out on the street. So my office, as stated in the agenda item, we are developing sort of a criteria and a criteria for exemptions. So there will be a way for departments to request and justify that they have a mission critical, grant funded, some sort of exempted position. There will also be a sort of a list of blanket exemptions, which means they don't have to come and ask the CAO's office for approval. And so I suspect many of our public safety positions will be in that category. At this time, we're going to do our best to make sure that we have what we need on the streets. And so that's kind of how I envision that working. Hopefully that answers your question, unless you want.
Yeah,
some
no,
more specific
I just wanted you to specifically mention, because I know that's something that members of the public that may not have read the agenda may be overseeing, that I think it's important that we highlight.
I can't promise, just to say, Mr. Chair, I can't promise that there may not need to be other types of, as we go through our budget process in 2021, we're going to have to discuss other ways that departments can help reduce their expenses without putting public safety in jeopardy.
Sure, and I understand this isn't an overall budget conversation right now. This is just a proactive tool that we have in our toolbox to make sure that the impact is as minimalized as we can possibly make it. Tremendous concern, obviously, within the public safety sector, but one of the things that you didn't mention in your comments was the increase in costs that we already have entered into agreements for this upcoming year. So I appreciate your comments about revenue forecasts. I think that's deeply concerning. I know that I was a part of this board during the Great Recession, and one of the actions, or some of the actions that were undertaken at that time, did push some costs down the road. They helped us at that time, but hurt us a few years down the road. I would just encourage you to look at the future impacts of maybe making a decision to kick the can, so to speak, and have those increased costs burden a future board, as I know that even without some of those decisions, we have increased costs that just are a part of doing business here within the county. I have a request from Supervisor Townsend to make comments.
Thank you, Mr. Chair. Thank you, Jason, for the report and for all the forethought that you and staff have been putting into this. Just a quick clarification on the report. It mentions a $64.6 million reduction in budgeted salaries with eliminating the vacancies and a $18.6 million savings to the general fund. Are those both for this fiscal year, or is just the 18.6 for this fiscal year and the 64 is ongoing?
So in theory, if we were to freeze every single position and not do anything, no exemptions, no nothing, every single vacancy, that would be sort of what we could sort of squeeze out of the system. We know that's probably not likely to be the net gain because, again, there will be needs for exemption, particularly exemptions for COVID-19 response positions. And so that's sort of where that number comes from.
Okay, so that's so the difference between the 18.6 and the 64.6.
So the difference between that is the 64.6 is the entire budget, because remember, not everything falls in the general fund. We have outside funds where fire, library, and other departments. So that would be sort of everybody, and then the 18.6 would be those departments that fall within the general fund savings.
And it's all within this fiscal year alone at that point.
I'd have to get back to you, but I believe that's the case, yes.
Okay, because I was just comparing it to the cost between 21 and 27. And so if the general fund is, the anticipated expected revenue loss, I should say, 21, 27, and then comparing that to the 18.6.
And it may be the rest of this year and next year, so that's the number. So
Okay.
it's the rest of this year and the following year.
Thank you.
Okay, Supervisor Crocker.
Thank you, Mr. Chair. Thank you, CAO, for putting this together. I think this is a very prudent plan based on everything that we're hearing. I know this is, discussion point all over for, especially, in light of the fact that because we're just under that $500,000 threshold, we don't have the additional revenue that's coming in that would be, that would more than cover these costs, and we could actually do some additional things to be proactive and help with some of the things we're doing. But because we're, 15,000 people short roughly or so based on the last Department of Finance updates, that we are now penalized because of that. And I think it's important to note that, this may be a little bit unique to some of our larger neighbors around us and cities as well, that they have additional resources. So I'm completely supportive of this and recognizing that this isn't an easy step, but I appreciate all the departments being able to work with this process, knowing that this isn't taken lightly, and that hopefully this will just be a temporary issue, a one-year kind of issue, and theoretically maybe even shorter than that, but realistically probably at least for the upcoming fiscal year. And then once our economy gets back up and running and moving and doing great, then we can go back to filling vacancies and to hiring people to provide the great services that we do.
All right, thank you, Supervisor Crocker. Supervisor Valero.
All right, thank you, Chairman. I too just want to share, and I believe that dramatic mitigation is needed in order to keep our county healthy. I know many counties are looking into this already, as mentioned by our CAO, and we have to continue to do the same. And I also believe that essential operations must continue in order to move this county forward. I know this is difficult, and neither of us on this dais want to be in this type of position. But I am confident that taking proactive measures now will give us an opportunity to stay ahead of this fiscal crisis and to prepare for financial downturn. And again, going to echo some of my colleagues, I am confident in our CAO and his ability to work with our departmental staff during this pressing time, because we need to be prudent at this time to implement measures for a healthy Tulare County. And so I think that this is something that is definitely needed at this time. So thank you.
All right, Supervisor Shuckley.
Yeah, I guess I want to echo what Kyler said and Supervisor Valero. Thank you, CAO. I know there are tough decisions to make, but I also want to point out the fact that that is another reason why we do want to see our businesses reopen and whatnot, because this has an effect on the county also and the services that we provide. So that's it. I am supportive.
And I'll just echo the comments as well, and thank you for bringing this forward. I know this is not an easy tool to call upon in your toolbox, but I also want to just make a general point as we move forward into the budget season. I know this is a temporary hiring freeze, but I also think it's important that we look at the vacancies in our departments, and if they are multi-year or if they have been on the books for a long time and not been filled, I think it's important that we right-size our departments now based upon our need to provide services going forward. There's a lot that's going to change coming out of this coronavirus, COVID-19 pandemic, and utilization of office space and possibly looking at work from home or mobile options. I think it's very important that we also look at the right sizing of our departments on a go-forward basis, Mr. CAO. I just want to make that point as well. So that being said, I know this is not a difficult, or I'm sorry, this is a very difficult decision for the board to make and for you to even propose. We will take up public comment before any action. Madam Clerk, do we have any phone comment?
We do not.
Okay. Any public comments from members of the audience who are here today? All right. Seeing none, I will entertain a motion. We have a motion by Supervisor Shucklian, second by Supervisor Crocker. Please vote. Motion passes 5-0 unanimously. We will now move on in our agenda and take up item 15. This is an item where board members can make a referral to staff to have a matter of business considered for a future agenda. Keyword considered. Is there any comment from members of the board for future consideration? Mr. Crocker, Supervisor Crocker?
Yeah, I know this was stated earlier during item 2, but I just wanted to reemphasize that if we find a need to have a special meeting,
yes,
then I'm very supportive of doing that.
Okay. Any additional comments? All right, thank you very much. I know that we have scheduled an 11 o'clock study session. This concludes our regular open session of our board meeting. Madam Counsel, do we have closed session that we can take up in like a minute? Because I want to give a 5-minute restroom break, and then Supervisor Shucklian has a statement. So I'll turn to you first.
We do have need for closed session, but I believe it'll take longer than just a moment.
Okay, so we'll take up closed session after the study session, and I do know that Supervisor Shucklian has a comment to make before we adjourn for a break.
Yes, Mr. Chair, regarding the closed session, I have a financial conflict of interest under Government Code Section 87100 regarding closed session item G. I will not attend the closed session for item G and will not obtain or review any non-public information regarding the governmental decision. The clerk is requested to make this announcement part of the official public record of today's meeting.
Okay, thank you very much. We will now take up a 5-minute recess. We will reconvene at shortly after 11 o'clock for the study session. Thank you for attending today's board meeting. Open session adjourned. All right, thank you for your patience and allowing us to have a brief recess before we take up our study session. We will now take up the first part of our study session, which is a presentation regarding the Tulare County Regional Transit Agency Joint Powers Agreement. Okay, Reed.
Good morning. Reed Schenke here with the Resource Management Agency. Thank you for having us today. Real briefly, before we get started on the discussion particular to the consolidated transit JPA, wanted to give a little bit of an update on where we are with transit in relationship to the COVID-19 issues. Our current transit operational status is we're offering free rides for all riders throughout the county. This is consistent with most of the other transit providers. Provides some, I guess, transmission reduction opportunities, and then also we've got challenges with retail sales for passes. We're doing additional cleaning on the buses. We've brought in a special, I guess, contractor that comes in and does that in addition to our normal cleaning routine for the buses. Ridership is down, probably anywhere from 50 to 70% reductions based on different routes. This is consistent probably with some of the other cities and other transit providers. Federal funding is coming in due to CARES Act to offset some of those losses due to fare box revenues. Another item, kind of good news, is our TOMF, our Operations and Maintenance Facility. The construction's nearly complete. We're getting water and gas online in the next few weeks, and we're starting conversations with the transit provider who's currently in the city of Tulare to move over to that as their new home base. So with that, if there's any other questions on general transit operations, I can get started on the consolidation discussion. Thank you for taking the time to discuss the proposed consolidation of Tulare County transit agencies. I know you've been a part of a number of these discussions and presentations as you serve as representatives on the TCAG board. We did want to take an opportunity to talk to you about kind of the specific county, the TCAT specific issues as it would relate to a potential consolidation of different agencies. I want to thank our colleagues at TCAG that they've moved the ball this far. It's gone a long ways. The conversation has gone on for a few years, and so really do appreciate the efforts that they've put out to take it this far. Ross will be doing the majority of the kind of presentation here. He is the transit expert, but there's a few things that I wanted to really highlight before we get too deep in the weeds. Transit's a pretty complicated beast. There's a number of different revenue sources, different regulations that we have to follow. It's a big book. Every funding source you get comes with a whole stack of certifications, assurances, and regulations that come along with it. Each agency does have special considerations. We're more of the rural agency, so comparison to a more urban provider. There's route types, ridership types, service levels, expectations. Do we provide the Chevy or the Cadillac or somewhere in between? So a lot of things go into the consideration when you develop what that transit provider or that transit agency looks like. To be clear, the proposed consolidation system can have many benefits. It'll provide a more seamless rider experience. Improved system integration across jurisdictional boundaries. So from one city or county to one agency to the next, we can eliminate a lot of those barriers. And a potential for increased efficiencies, both operational and fiscal, a lot of which we'll get into in the presentation here. But there are some trade-offs, and we wanted to be transparent and clear and present those to your board as well. You would be giving up independent board autonomy over TCAT. Right now, your board makes the call on how the transit in the county looks like. If we do proceed along the lines of the consolidation, you'd be one vote out of, depending on how many parties play, 6, 7, potentially 8 parties there. So you'd be giving up some of that independent authority. On the trade-off side, you would be getting a little bit more say on how the service providers look within the cities. So a bit of a trade-off there. The JPA will set the service levels. The current kind of document for the formation of the JPA leaves a lot of authority up to that future JPA. So that board, that staff will be making a lot of calls. So as we get into how much will it cost, we really don't know because we won't be setting those criteria up until the JPA is formed. So there's a bit of uncertainty going into it there. The county transit expense calculations would change. They may go up, they may go down. At this point, we really, like I say, we really don't know where they would go. And something near and dear to my heart as kind of the pothole hotline, we would be reducing control of the LTF funds. I don't want to say that we would reduce our actual LTF funds. As background, excess LTF funds, they're initially set for transit. If it's not spent in transit, then it can fall down or trickle down to roads for road maintenance, and it's basically a discretionary road fund. So we would lose control over that because that JPA would now be setting those budgetary guidelines and identifying the service levels. Again, just a little background. We've, over the past 5 years, averaged about $3 million per year of excess LTF funds. that's gone into road maintenance. So that's a little over half of our LTF funds that were allocated each year. That's about 4 to 8% of our overall roads funding discretionary money. So it's a sizable chunk there. Like I said, discussions on the consolidation have been ongoing for a few years. I want to thank Supervisors Shuckley and Crocker specifically for their active role in moving this forward. Thank you. You've both been involved on that. We at RMA certainly support the goal of providing better, more efficient, and cost-effective services, and improved coordination amongst the transit providers can help us get there. The draft JPA formation document is currently out for board and city council input and review, recently approved by the TCAG board. RMA staff fully supports the direction that your board instructs us to go on, whichever way that may be. And we hope through this presentation we can provide you with the input and the background and the information you need to make that decision. So with that, I'll hand it over to Ross to get into some of the details. And like I say, I know that TCAG staff is here, and I'm sure they'd be happy to answer any questions once we're through with the presentation.
All right, great. Thank you. Clean shaven, Miss Ross. Welcome back to the, yeah. There's a face under there.
I miss my beard. Good morning, Board of Supervisors, County Council, CAO. My name is Ross Miller. I'm a Chief Engineer with the Tulare County Resource Management Agency. So just to cover what I'm going to cover in this presentation real quickly, I'm going to give just a bit of background about the mission statement for Tulare County Area Transit, a bit of a system overview, just kind of catching up on changes that were made recently, talk about the other Tulare County transit agencies and how we currently work together and roles and responsibilities that the various agencies have taken on. I will talk about the history and background of consolidated transit, at least for the last few years, and kind of how we got to there being a draft agreement out. Talk about the 2019 Tulare County Regional Transit Coordination Study. This was a study that was done, commissioned by TCAG. It was created by SBLB, who are transit planning experts. It was done with the idea of looking very deeply into what a consolidated transit agency in Tulare County would look like and ways to bring that about. I'll talk briefly about some of the proposed terms under the JPA. I'll talk about some of the benefits to riders and administration, talk about the county's share of costs, as well as just some discussion on the proposed agreement, good and bad. And I'd like to point out that as I move towards talking about the specific agreement, the goals of consolidation are fully supported. We've just expressed concerns with how consolidation is proposed under the current agreement. We don't want this to be misconstrued to thinking that we don't like the idea of consolidation or we don't want to move in that direction. We just are looking at this as the Resource Management Agency who operates both transit and has those concerns, as well as operates the roads department and has those concerns. So we want to make sure that using that sort of multi-lens focus that we are doing what we think is, or we are recommending what we think is in the county's best interest, but we are trying to present it as objectively as possible. So our mission statement. Tulare County Area Transit provides customer-focused, safe, friendly, clean, reliable, cost-effective public transit service which increases access and mobility for all, reduces congestion, and improves the environment while supporting economic development. We've had these same goals for years, and we continue to try to live by them. To give a brief overview of our current system, TCAT primarily operates the intercity routes between the various cities of the county. The major exception being Visalia to Tulare is operated by buses from both the Visalia Transit and Tulare Intermodal Express. The 4 largest routes we currently offer are routes 10, 20, 30, and 40, though Route 90 also does run intercity between Porterville and Lindsay. We also operate a few routes that are rural circulators. They provide mostly lifeline service. They come every 2 hours or so, or not 2 hours. They come every 3 hours or so, so there's not a lot of service being provided on them. but they are connecting communities to the cities for essential services, which is more important now than ever. We also recently, as of August 2019, switched to operating what is called a flex route in the city of Lindsay. During the morning, the bus operates as a dial ride for the city of Lindsay, then it transitions to a fixed route bus that will deviate to pick up paratransit customers, then it switches back to a dial ride service later in the day. We offer transport as required under the ADA for customers that live near but not directly are on our fixed route services. It's known as route deviation. It can be scheduled ahead of time. We operate the Loop Bus program as well on behalf of the county. And we currently have 21 transit buses and 3 Loop buses. We have a maximum pullout of 14 buses at a given time, and we have about 3.5 full-time equivalents at this time. So for the other agencies, the largest in the county by leaps and bounds is Visalia Transit. They run about 156,000 service hours per year. This would be hours that a bus is on the road and picking up customers. They run service for the cities of Visalia, Farmersville, and Exeter. They run dial ride as well, and they provide service to some unincorporated areas, including Goshen. They operate the Green Line Call Center, which is a county-wide transit information. It's a single hub where customers can call in and learn about connecting, ask where their bus currently is. It's a nice resource to provide easy and convenient information to the public. They also operate the V-Line, which is a commuter bus between Visalia and Fresno. And they operate Sequoia Shuttle, which takes you up to the park. Then Porterville Transit next. They also operate fixed route and dial ride and serve some of the adjacent unincorporated areas, including East Porterville. And they provide under a separate contract services to the Tule River Reservation. They receive money from the tribe, who in turn gets their own transit funding. There's Woodlake Dial Ride, which is just a small dial ride system serving Woodlake and some of the adjacent unincorporated areas. There's Tulare Intermodal Express. They serve primarily the city of Tulare with fixed route and dial ride, though they do have a connection between the Tulare Transit Center and Visalia Transit Center. There's Dinuba Area Regional Transit. They serve the city of Dinuba with dial ride and fixed route, as well as operate the Dinuba Connection, which goes between Dinuba and Reedley. And they do receive some funding from that from the Fresno County Rural Transit Agency. And lastly, there's us. We operate about 37,000 service hours a year. This puts us kind of on par with city of Tulare, a little behind Porterville, and quite a bit behind what Visalia is doing and ahead of what Dinuba is doing. So we're towards the bottom middle of the pack, essentially, in terms of the total service hours we operate. We also we administer the T-Pass, which is a regional monthly pass option for riders that they can use on all of the county transit agencies. We do the administration of that and help coordinate between the different agencies, distribute passes, that sort of thing. And we've also been the operator for the city of Lindsay for longer than I've been with the county, and we're currently operating the flex route that was mentioned earlier for the city. There is a monthly transit forum. This is sponsored by TCAG. All of the transit operators have the ability to come together every month and discuss transit issues and general direction. It has been good in that it's helped keep all of the agencies informed as to what everyone else is doing. However, there's always been limitations because the group has never had formal decision-making powers. And, you know, as much as we would want to move in the direction of unifying to buy the same technology or something, the power structure was never there for us to initiate that at the staff level. However, we did, under that, form a committee recently to review technology packages and make sure that we could comply with all of the procurement requirements for the individual jurisdictions. We were scheduled to have a meeting with our first vendor at the end of March, but that obviously has not led to an in-person demonstration as we need. In 2017, TCAG did a study that was the Tulare County Long Range Transit Plan. This plan identified 35 action plan items in 8 functional areas, which included considering a joint powers authority among transit providers. This then led to the 2019 Tulare County Regional Transit Coordination Study by SBLB, which kind of led to the current JPA agreement that's being considered at the moment. As a result of that, an ad hoc committee was formed to consider the JPA, which was composed of members of the various, members of TCAG, including Supervisor Shockley, serving as the representative for the county. County staff, myself, attended as well as support. The draft JPA was produced during this. The 2019 study also included recommendations for policymakers to implement. This is a slide that I've included later on. I don't feel the need to go deeply into that. I've included it for reference, but if anyone has any questions, I'm more than happy to discuss it. And this is not to say that this was the first time that regionalization was considered. That's been discussed for many years before that 2017 study, but that one just kind of helped sharpen the focus more recently. So the 2019 study, I'm going to highlight a few items from it. The study was designed to assess the potential for the evolution of the 6 transit systems in Tulare County into a regional network that offers citizens in the urbanized areas improved mobility and improved economic productivity while maintaining the rural transit connections. The study also proposed one of 2 service level models, which was one called the clean slate model, which was designed if no transit service were here, how would they design it from the ground up? Then another one was called the one region model. This was designed to essentially say, this is where service levels currently are. This is a few nudges towards making it a better regional system and towards a better model overall while respecting and not significantly interrupting current levels. It's worth noting that the one region model is significantly different than what is currently in effect from all of the transit agencies. It would require significant changes to services in Visalia. It would establish new intercity routes. So it's not close and would have significant cost changes over what is expected by the current service models at the individual cities. It also provided case studies from other consolidations, looking not just at the JPA model, but at all sorts of consolidation options. And as mentioned, Section 6 that include the recommendations for policymakers to implement coordinated transit. These were the recommendations. Just 2 that I would like to point out were, they recommended that the service plan options be presented for more detailed service discussions. This hasn't really happened during the ad hoc committee. There was some brief discussion on this matter, but no definitive decisions made regarding current service levels versus the, I believe, one region model was preferred out of those meetings. And without full service models, it's difficult to estimate what actual costs will be. In addition, this also recommended that a 3-year capital and operating budget be presented and evaluated before moving forward. A full proposed JPA budgets have not been prepared at this time. So again, it would be difficult to estimate what the county's expected contribution, if a JPA were implemented, would be for the next 3 years. The 3-year timeline was implemented as a kind of a horizon, because after that it will become more of the JPA's issue, but it was kind of to bridge the gap between current service models and the move towards the JPA. So there were also a combination of recommendations for managers to implement coordinated transit. Again, I wasn't intending to go too deeply into this. Most of these have been adopted or were intentionally left later in the process. Some of them or need to occur later in the process. One being explaining to bargaining units under collective bargaining agreements how this would happen. At the county's level, we have 2 full-time transit staff, one of whom is represented by a union, so that would require a meet and confer. The other one is an at-will employee who is our transit manager. Are there any questions on either the recommendations for policymakers or the recommendations for transit managers before I move on? All right, I will keep going. Just to cover some of the important and larger terms that were looming from the JPA. The name, as stated previously and as part of the item being considered, or at least for discussion here, is the name determined was the Tulare County Regional Transit Agency. The actual service itself would be rebranded, but that would be by the discretion of the new board to determine how they would brand it, what steps they would take in that regard. The boundaries of this agency would extend to basically be countywide plus whatever cities internally have joined. The voting members would be 1 regular and 1 alternate from each member agency, including the Board of Supervisors. And this was the subject of quite a bit of discussion during these meetings, but the result, if you move down 2 items, is that voting would typically be by a majority of the board for this new agency. However, unanimous consent would be required to approve the budget, approve LTF claims, to approve early withdrawal of a member agency, or to approve readmission of a former member agency. This was to make sure that all agencies could be fully represented and were satisfied with the outcome of the budget and with the other items. Also, given an ex officio seat on that would be the TCAG, on the board would be the TCAG transit rep, as well as a representative from CalVans. As written, the minimum levels of service would be, there would be criteria established by the new agency, which would then be used to evaluate transit services throughout the county. This would, sorry, I've skipped ahead 2 slides. This would potentially include looking at what the correct headway in a dense urban area is, or denser by Tulare County standards, for rural circulators for intercity services, also considering other factors. And that would then determine what the appropriate level is. Member agencies would then be free to request additional services beyond that, which do not necessarily have to be provided, but would be considered by the agency whether they could provide that and how they would be funded. But the agency, the member agency, could decide to essentially pay for that out of hand. As mentioned, a member agency would submit a request to add or reduce service, which is then considered by the agency. If they're being considered below what the standard service for a specific area is, the reduction would not necessarily, the cost for the reduction in service would not necessarily be seen by the member agency, but would be more distributed among the group. However, increases beyond what is called for by the metrics and other standards set would be paid for by the member agency. The funding overall, first, the agency would use all of the transit-only funds. This would include STA, which is a state act, 5311, which is a federal funding for transit that our system relies on, 5307, which is a federal funding for transit that City of Visalia and Tulare rely on, for example, and other transit-only funding would be used first. Essentially, after that has paid for everything it can, the gap between what that covers and what is outstanding would be made up by LTF. And there's a specific formula proposed for LTF, which is based 50% on population and 50% on service hours. And we'll return to that a little later in this discussion. And it's worth mentioning as well, Reed talked about it, LTF money that is not used for transit is available for roads. However, in order to transfer it from transit to roads, an agency has to be determined to not have any unmet transit needs that are reasonable to meet. We are currently going through the unmet needs process every year, which is facilitated by TCAG for all of the agencies. We submitted our comments in response to the comments received for unmet needs last week. So that process is currently going, but it happens every year, and that's an important part of making sure that the LTF money remains available for roads. Further, for assets, it was determined that essentially each agency would be able to keep its assets and would then enter into a separate agreement with the JPA once it's formed to lease their assets, primarily their buses and any capital assets such as our transit operations maintenance facility if the county so desired to lease that to the new agency. But going forward and into the future, this new transit agency would purchase new assets, new rolling stock for buses and other items as necessary. In addition, just talk about service agreements. It was determined that the current service agreements would remain in place until they are sunsetted out. The intention was that they would be transferred or assigned to the new transit agency for them to operate and then to be rebid as appropriate once they expire. So to talk about just some benefits to riders real quick, a new single transit agency, as mentioned previously, would have the option to do uniform branding. All buses could be branded the same. It could eliminate some rider confusion about which route you're supposed to be on, and everything would start to look the same. All of our information would be presented the same, so it does have some advantages there. It also allows for a stronger, more rider-focused planning with less concern on geographic boundaries. You know, we, the county, focus on the unincorporated areas, the cities focus on their areas. However, we do have annual agreements with each of the city transit agencies to serve some of the surrounding county areas. The new agency would have some options for additional fares. They could more easily implement weekly fares, daily passes, some multi-ride options. Currently, we only offer the monthly pass, which you can also purchase mid-month, but this would give them a little more freedom. And lastly, they'd have a benefit of uniform technology, which I did say that we've tried to establish a committee for through the Transit Forum to satisfy all of our procurement needs. But if it's one agency with one policy, it's easier for them to have the same fare readers on all buses and such. Next, some benefits to the administration. It does allow for economies of scale and more specialization by staff. As I mentioned, we have 2 full-time transit employees. Everyone else is part-time, often working in roads or in other departments who help transit out with some of their time. It would reduce the coordination, planning, and reporting requirements with the state, FTA, et cetera. So instead of submitting, 6 transit asset management plans, we'd submit 1. Instead of submitting 6 applications for state funding, we'd submit 1. And lastly, it would also add for combined bidding. And it would be true that there would be more competition for one larger service contracts. After our most recent bidding event, I did a lot of a post-mortem, so to speak, talking to a lot of the transit agencies, or not transit agencies, transit service providers, to determine essentially what were the problems with our bidding process, because our results came out higher than expected. And the determination was that even though we attempted to package our transit agency with City of Tulare, with City of Visalia, it was too much at once because there were different requirements under the different agreements, and there were different requirements for named personnel under each of the agreement. So one combined would have a distinct advantage over the several that we currently do, even though we've tried to work in coordination on that. I mentioned that the share of costs, again, this is above and beyond what is available from transit-only funds, would be divided between the member agencies based half off of hours and half off of population. This is to present the hours requirements. As currently operated, we'd be about 12.6%. It's worth noting, though, that this isn't foolproof by any means. The agency would have to make a lot of determinations about what counts as county service versus what counts as city service. For example, right now we pay for buses that start in the City of Visalia, drive 5-10 minutes through the city of Visalia before they reach unincorporated area. Who's paying for those 10 minutes? That was not clear under this agreement, and that would be a policy that's left up for the new agency, and that would be part of their majority vote. It also did not include some things like who would pay for regional services like the V line, which does have regional benefits beyond the city of Visalia, but if it's based where the hours occur, the county would be paying the lion's share because most of the time it spends on the freeway going up and down the 99. So through this estimate, assuming that we're responsible for roughly similar to what we currently operate, which again could change because we do pay other agencies for unincorporated areas, as well as we are paid by the city of Lindsay to operate their service, we'd be around 12.6% of that, or 6.3% of the total. By population, the county is around 30%, which brings the total county share to around 21.4% of the agreement. We, at RMA, looking at this, began to worry after crunching the numbers that this is actually quite high, that we would be responsible for essentially more than our share, because while we're responsible for 30% of the county's population, we are also responsible for the largest share of riders who are unserved or underserved by transit agencies. During comment letters, we did propose that they consider adding in a factor for those who are served, but that proposal was rejected. And to return as well, this also assumes that all potential agencies are joining. There has been some concern about whether one of the member agencies may join, which would probably impact 2 of the other member agencies. And whether or not they join, some of the rider benefits that were discussed earlier may not be recognized if we do not have full participation. It could improve things, but the difference between 2 agencies and 1 agency for some of the rider benefits that were discussed are pretty drastic as compared to just having 1 agency run everything. So just coming back to a discussion on the proposed agreement, again, for our share of the county's share of costs, we would have the largest proportion of unserved and underserved residents. There's no initial budgets being adopted, so our initial contributions remain unclear at this time. As written, the Tule River Tribe, because it is an unincorporated county area, would count towards the county's population count. However, they're eligible for other state and/or federal transit funding, so we would be responsible for their share even though they get separate money for that same purpose. There are many policy decisions related to costs and cost sharing that are to be determined by the agency after it is formed. A lot of the decisions, some intentionally, some unintentionally, were decided to wait and make it the purview of the new agency to kind of self-determine a lot of these items. So it just creates a lot of uncertainty, so we can't quite fully assess the impact to our roads fund. It would, it's also worth noting that this is definitely a positive, is that the proposed JPA would not obligate the county to contribute general fund money. We would have the option to contribute general fund money if we decided to run a program out of the general fund, but there is no obligation and no requirement that the county do that under the way that the current draft of the JPA is written. Voting structure, again, I touched on this earlier, but the county would have 1 vote, which is not proportionate to funding our population. And again, that was why the unanimous approval requirement for funding and other items was added. But it does lead to the possible that there could be a potential impasse on the annual budget or LTF contributions, because again, if there is one holdout for whatever reason, that could end up with a JPA, a transit agency that is unable to pass a budget. The county would also need to determine which supervisor will serve as a member and which as the alternate for the board of directors. This is just a minor point, but it's something that the county would need to delegate when passing the JPA. I want to talk about road funds impacts, just to return to this, and I think Reed has slightly better data if you want to talk about the road fund impact.
Sure. So again, the road fund, this is the trickle down from the LTF. We're looking at projections for fiscal year 2021 based on the recently approved CTIP. to get about 4.5 million of LTF money to come in to be spent on roads projects. That's about 7.5% of the road fund budget there. But because of transit expenses kind of changing throughout the past years, our average has been about $3 million of LTF over the past 5 that's gone into road funds. And that's based on things like we've spent LTF money on the TOMF project, so left less available for roads. So numbers there are what we're looking at projections for the next fiscal year.
It's also worth noting that though we are talking about the potential for the transit agency to save significant money on costs related to administration and costs related to reporting and operations, it's unlikely that in the short term, any of those costs would result in additional money being available for the roads fund. The agency would need, as a brand new agency, as a brand new entity, would need to start building their reserves. They would need to start building their emergency, capital, replacement, and other reserves. These are things that the transit agency currently doesn't really have. For cash flow purposes, for the last many years, we've used the TOMF project because that had about $10 million in the bank at one point. So that was able to serve as that. And then we not required a specific transit reserve be set up in years because we knew that if necessary during 1 year, additional money could be taken out of LTF, which would more than cover anything that any of the reserve funds would be intended. However, the new agency would need to build those because they would definitely not have any ability to do cash flow or other items in the short term. So long term, those would probably lessen, but in the short term, those would be significant for the agency to build up. But again, there is no initial budget for us to verify what those would look like. Yes, and staffing concerns. So as I mentioned, there would be a meet and confer required for the transit technician position. The transit manager is an at-will position. Other county staff would likely be needed in the future to participate in agency planning if they're doing transit planning, if they're doing long-range planning. County staff would probably want to remain involved in that since it is an important aspect of what goes into our general plan, as well as what goes into other county considerations. And county staff would also need to develop a close relationship with this new agency for assistance with the general plan and related planning documents, including transportation plans. So RMA and the new agency would likely need to maintain a close relationship, or other county staff, depending on how it is assigned. Transit services, again, just noting that first item, we'd have less power, so we could not unilaterally make some decisions that we are able to now. This is worth considering. Then development agreements, because the transit agency has been in the same office as our planning agency, this has allowed some synergy. So we've been able to work on, so as the county was working on some development agreements with groups like for the Sequoia Gateway project over off Caldwell in the future, we were able to work with them to create the transit requirements and ensure that that could be incorporated into the current transit system. We were able to work with City of Visalia, who would operate that because they operate that area, including Goshen, for us. And that would just add another layer of separation between the transit side and the development agreement side. It would also require the county likely to enter into a separate agreement for the loop bus and for emergency services. This could be done under request, but a separate agreement would help better define terms and better define costs associated with these. In terms of oversight and agency growth, a transit-only agency may engage in scope creep. They may start trying to add other services, such as a bike share, such as car share programs, and that could potentially further impact how money is available for the roads fund. But the agency would be subject to some significant controls and significant oversight. There are financial audits, there's performance audits that the state requires. TCAG has determined a bunch of performance metrics and goals that this agency would also be required to report on and meet. And again, just on my last point, there would be limited benefits to riders and to administration if some but not all of the transit agencies were to enter into this JPA. So summary, again, there's potential significant benefits. The current JPA came out of that 2019 study, and the county's share under the proposed agreement, we estimated around 21.4%, but there's quite a bit of wiggle room on that, as other items would need to be determined. And that's based on, again, population and service hours, but some specific decisions would need to be made by the JPA, which are currently scheduled to occur after the JPA were to be formed. So with that, we'd like to enter into comments, questions, and discussion.
All right. Thank you for the presentation, Ross. Much appreciated. I do have a request from Supervisor Valero.
Yes, just a quick question before I formulate others, but do you know why the reluctance on one or others to participate in the greater kind of project?
I've not really been privy to any of those discussions. I've met with one of the city councilors who expressed that he himself was in favor of it, but he was not sure why. I did not get a clear answer from him why the other city councilors had expressed. I believe it was cost related, or control related, but I'm not positive.
Oh.
Okay, go ahead.
And then also just, again, along those same lines, do you feel like it's an all or nothing, or do you feel like we can still move forward should other smaller agencies or cities not participate?
So moving forward, if other cities were not to participate, the county could still choose to participate. We've outlined some of our concerns here and some of the potential impacts to roads fund as well. So of course the county could still participate. If this current draft of the JPA is not desired, we could also either try to come up with new terms for a different JPA, or we could continue our current course of increasing our consolidation and our coordination with the other county transit agencies.
And then just lastly, I just think, for me personally, I believe that we've needed a regional approach for so long already, and just being able to work in tandem with others will help provide, I believe, just better service for our, especially our rural communities, but just in general to begin those collaborative relationships across the board. So I would just like to say that I'm in favor of something like this.
All right, Supervisor Crocker.
Thank you, Mr. Chair. I have quite a few different items, but Mr. Chair, I'd ask that, I know we have a couple of folks from TCAG, if they had anything to say, I'd like to hear what.
Yeah, I am going to give them a chance, but I want the board to be able to ask questions of our staff before I call up anyone from the public.
Well, then I'll reserve my comments and questions till after that.
Okay, any additional questions for our staff before we open it up? You know, I just want to make a few comments, and maybe members from TCAG staff can make a comment. You know, I just want to make a comment. I echo some of the concerns that have been brought up. Obviously, I've been very supportive of a consolidation process. I think it's important that we bring it to where the rubber meets the road, and that's where we're at now, coming up with some key items to have addressed for the county to move forward with this. You know, I'm glad you mentioned recommendations for changing the JPA structure in terms of voting. I really have tremendous faith in the TCAG model. If you look at the way that TCAG has functioned, both as an MPO, as an abandoned vehicle abatement authority, as the Measure R administrator through the TCTA, there's a lot of benefit from that model of governance, and I think that that type of a governance structure would be something I would be more supportive of. I don't really like the fact that we are going to be saddled with 21% of the cost, and under the all jurisdiction receiving one vote model, we would have 11% of the vote, and if we added Calvans and other transit partners in there, then it would only be 9%. So that just seems very disproportionate to me, and I am significantly concerned with the potential loss of flexibility where we can offset transit or redirect transit funds to the road fund if unmet transit needs have been met, which we've been doing a great job over the years in addressing our unmet transit needs and able to move some of those funds over to the roads. And as you shared, it's over $4 million. I think that's very significant for the county. And then the last point I wanted to make too is I do have concern over our loss of authority over rural routes. I understand that we need to be in this together, but transit in the city of Visalia or the city of Tulare, and I don't even know that I'm commenting on a member that may choose not to be a part of this, but whether you're talking about Visalia, Tulare, Porterville, Exeter, Lindsay, Woodlake, any of those various cities, transit's different there than transit to Pixley or transit to Allensworth or Alpaugh. So having the flexibility to offer rural transit services is something that's very important, and I would hate to lose those services for those residents, as it's incredibly valuable for them. So those are some of my comments and my concerns that I wanted to raise with our staff. I will open it up to public comment. I know Ted Smalley wants to come forward, and he's ready to go.
Thank you, Ted Smalley. I'm the Director of Tulare County Association of Governments. Chair.
You pull the mic down.
Folks.
Yeah.
Is that okay?
Or you could just talk into the microphone, whether it's up or down.
All right.
It's up to you.
So we have a number of comments we want to offer. First of all, we certainly have a great relationship with RMA, and even though we may disagree from time to time, and in this case, some of the points we would disagree how they were couched, nevertheless, we are delivering millions and millions of dollars of quality projects. First of all, just on its outset, we would disagree there'd be limited benefit if one agency didn't join. That's just simply not true. I think as we look at the benefits of moving forward, the RMA director and the presentation highlighted some of it. There's lots of paperwork, there's lots of cost. And in fact, as I was preparing this, let's remember, the lack of not having this has already cost us probably over $1 million. So when we get to costs, we're talking about how much of this remainder might be, but we've already, because we've been messing around, I choose my words carefully, we haven't done it. And so the county just talked about, I think there was a 20% increase in cost at the county. And the cost in some of our other smaller agencies were much higher. Dinuba's is through the roof. What would have happened if we had been together? We would have been able to save 7 figures. And I think that's a fair assessment. And I will just not say how much into the 7 figures, but I would definitely say it's $1 million or more we would have saved. I would also note just the idea of better service. We don't hit that enough with you, and I appreciate Supervisor Valero sort of starting to touch on this. Let's understand, Ross said that they just started a subcommittee to look at technology. That's partially true. TCAG board asked the transit operators to do this 2 years ago. Now we're finally getting to a subcommittee. This tells you the problem institutionally. I don't put that on Ross. I put that institutionally. You need to remember, as transit managers, you got to go through the next boss, to the city manager, to your council. And it's taken 2 years to even figure out what kind of machines can go on buses. It simply doesn't work. And to another idea, I'm going to not pick on, but use North County as an idea why we need this coordination. When we look at Cutler-Rosie, we tend to forget sometimes Cutler-Rosie has 18,000 people in the census tract or so. Exeter, Lindsay, Woodlake, and Farmersville all have less people than that. And when you combine the amount of people in Cutler-Rosie and in Dinuba, you're looking at 40 to 50,000 people there, and the service is not where it needs to be. I'll just cut to the chase. This is a director's perspective, because 5 of you are on my board, and they have not taken an official position on that. But from this director's position, it's woefully bad. Each year, there's inconsistency of how to partner on Regaley College. As an example, I think this year the county is not contributing to help Dinuba get kids to Reedley College, and yet those are not simply just Dinuba citizens or residents. We could go through a lot of examples and what we need to do that we can adjust routes and do things different. And every year it goes by, we've lost time. I understand the voting deal. We have went back and forth for 3 years on voting. That's up to you electeds. What we could do at the staff level is protect the agency. I think it was understated today of the power you would have as a single agency to say no. The budget has to be something you agree with, or the answer is no. There's also, it's structured in such a way that you would be able to withdraw. There's an incentive to please everybody. We don't need folks going in and out, in and out. We need to please everybody, and that incentive's there. But I understand the voting deal, but I would say, please don't compare it to what other negative-based voting things. Can I leave it at that? And just know we have written this very carefully. I say we had people that wrote it very carefully to try to protect you. When it comes to revenues, again, let's be careful. That 21% is after all the federal, there's certain state money that has to go to transit. So it is not, the county is not paying 21% of all the transit. We need to be careful. That's a false narrative, and I don't think it was intended to be that, but it can be heard that if we're not carefully. I will also note that the county gets their LTF based on population. So I just would strongly recommend you not consider something that would change that. You do pretty good getting money by population through LTF. So I'm going to tell you there are no guarantees. All right? We're not going to guarantee you that costs won't go up. I will tell you costs have gone up, but have nothing to do with this JPA. And I've already shared, we probably have lost out on saving $1 million. And costs are going to go up. We've told our board, you guys are on it. Operations have skyrocketed and electrification is coming. And one of the ways to help us with electrification is to make sure we work truly as a team. And Ross works hard with the other transit managers, but it simply doesn't work, as Ross said. It's not just authority, it's just, you got to go back through months of bureaucracy just to figure out how to decide what a senior is. So one of the key questions moving forward will be what is causing the increases, because cost increases are coming. And if we don't do anything, you are going to have to reduce the service you have. The electrification is going to be a pain in the rear end, and even if it gets delayed. So I know that looking at the administration in one area, the consultant concluded around 10%. And while 10% might seem small, but think about that. Every year if we're saving $100,000 to $200,000, what that could go to. And finally, on the staffing part, I just want to give a little bit of context. This is not anything new. The staff from Dinuba and City of Tulare, they would not be staffing for consideration as part of just because they're part-time. The idea of going to a one agency for those staff means great. I just crossed off a part of my work list. So what I'm saying is there is room, depending on however the agency is structured, under what agency, that would be able to accommodate staffing. So we've seen this before, and I'll end my notes now. We can be scared of change or use change as a tool to improve services for our residents. The only guarantee is if we do nothing, nothing will improve. And so on behalf of the TCAC board, I'm just encourage you to look at what we can do to move forward. We can in ad nauseum study the JPA for 2 more years. And when we're done, we're going to have another session like this, and you're going to have questions. And a lot of them are fair. But we need to be able to move forward. And I want to encourage you all. I think in the end, we're going to see cost savings, and we don't want to repeat of last time where we had a chance to save a lot of money for this county, but we didn't have the structure in place to work together. So notwithstanding, I'm happy to answer any questions about the voting. I would just note on that, we took an agreement that's working in the valley. In other words, we didn't go and see what the Bay Area is doing or any of those places. We looked at what's going on to our neighbors to Kings County. And I assure you, the first thing we asked ourselves, did that county, the unincorporated area, be able to claim streets and roads? That's immediately what we first looked at. You can ask Elizabeth, I'm not in the room, what was able to happen? We knew this would be an issue coming along. So there's, I think, an opportunity to be a win-win. And yes, there's unknowns, and it's fair to say that. But the other side is if TCAG staff or others had tried to fill in those blanks, then we would have just been destroyed for filling in the blanks instead of letting the JPA start to do that. And I think it will be, as Ross sort of alluded to, a long implementation. It's not a quick implementation. It will take some time to lay things out. So with that, I want to encourage you, and I stand ready to answer any questions, Mr. Chair or Board.
So a question that I have for you, Ted, I just want to make sure that it's clear. I didn't by any means mean that I'm against this thing and I'm a no vote. I wanted to make sure that some of these concerns were brought up and highlighted. One thing that I do want you to just comment on is can you talk about the viability of this JPA and notion going forward should, say, a city of Visalia not participate?
It was already contemplated in the report, and so there's a game plan to move forward either way.
Okay. Thank you. Any additional comments, Supervisor Townsend?
Yeah, Ted, a little bit for you. You mentioned a $1 million loss. What was that $1 million loss you mentioned?
What I meant was we had everyone do their separate process to go out to hire a transit provider. And the costs were astronomical. And Ross highlighted a critical issue that he was told, well, it didn't really work to put you all together because you really weren't together. What you were was a conglomerate of proposals stapled together. With a one JPA model, that wouldn't be the case. It would be, here's our JPA, and it's not a bunch of different systems put together, it's one system. And I just can't help but wonder what would have happened and how much money we would have saved if we were one system. And that's why, from my standpoint, I get the political challenges. I worked with you guys 20-something years. I get it. But we have an opportunity, if we can work together, to potentially, especially with the next contract coming around at some point in a number of years, we want this in place before that happens, so we don't have a repeat. And I think just that alone, our office can try to take a look, what would that look like if it was just 10% less, that contract, how much money we would have saved. And it would be a lot of money across multiple agencies. And so that's what I'm looking at is, the old adage, if you do things over and over again the same way, don't expect a different result. We need to find a way to get a different result.
I want to ask might be two more questions, but that was one that I noted that you had brought up. The other one was brought up several times, and you alluded to it too on the LTF fund. You mentioned that there probably wouldn't be an LTF loss, but what would that look like if we're?
I want to be careful. I'm not going to guarantee anything. That's why I think it's a fair comment by Ross. We work things out. All I can tell you is we were very cognizant of that issue on behalf of the county from day one. We looked at JPAs that would respect that. So we looked at a JPA from the valley in which consistently the county has always got streets and roads claims. We structured this so that there would be a base level. And the county would have to, in essence, some way get their way or they would vote no. So in other words, we've tried our best to, one, choose a base model that makes sense, two, make sure you have protection, but I can't guarantee the future because one of the big things is I don't know what the electrification cost will be. So the possibility of LTF going down is likely. The question is, will LTF go down because of this JPA? That's what we're hoping not. We're hoping that we can do things to save money, both on the admin side and potentially on the cost-sharing side of services.
But the one that you alluded to, was it in writing that the county would keep the excess LTF funds?
Well, it's the...
Part of the agreement?
It's the law. I mean, the
I mean, once the JPA is formed.
Huh?
I mean, after the JPA is formed.
Well, the JPA can't just go take money. In other words, if we needed to, we could add a line that said that. It would be redundant to law, but we could add that line that excess LTF can be claimed by member agencies. That's not a problem because you're required to do that. And I don't think that would be an issue to add that line if you want to.
And there's one more thing, if you would indulge me one more. The county share being 21.4% roughly, and you made some comment about it, but I didn't catch exactly what you said. Did you agree that that's what it looks like based on the formula, that the county share would be 21.4%, even though our hours used are about 12, little over 12?
I think the issue with that is to be careful and say the county is not paying 21% of this JPA. What the county would be paying is a share of what is needed after all the federal and state transit funds are used first.
And that would be 21% of that?
Yes. And what I pointed out is, however, the county, let's note, gets LTF money based on population. It's not as if there is, in fact, by doing it half and half, it really favors the county as opposed to 100% population.
I mean, but does it have to be the same? Do we have to use the same formula for the LTF funding that we do for cost share in this? Like right now, there's a cost share funding of 50% of hours, 50% of population. Can we modify that?
Well, the JPA could modify. I'm not trying to be smart, Alec, here. The JPA could change that, modify it to whatever they want it. That's correct.
Yeah, I mean beforehand, before we agreed to
I mean, if that was something that was, there's all kinds of different ways, and I think that if that was supported, that would be, it's just a matter of a number, a percentage number. So I think what was done is used what's very standard in the industry, and that's what was done here.
Thanks.
All right, Supervisor Valero?
Yes. So I'd like to say that I'm on this dais to also represent a female student from Orosi High School who actually had a medical internship in Fresno last year over the summer for 6 weeks. And it took her 2.5 hours to get from Orosi to Fresno for her internship, having to navigate the system and go through all these communities, getting to Visalia, having to reconnect and go. And so it's just, I'm hopeful, and I feel like by doing this, we're moving forward and we're reimagining what our transit system could look like regionally. So like I said, I'm still going to continue to push for this because this is a much needed project that has been stagnant and taking so long. And I want other individuals like this female student who may have internships in Fresno or elsewhere or even across the county to be able to really have the ridership opportunities, because obviously some of our youth also lack the opportunities for travel. And so the best way would do that is to really put forward these ideas and move it forward. Thank you.
All right, Supervisor Crocker?
Thank you. Mostly comments that I have. I think that we've trusted TCAG, and I think that was stated that they've done a great job. The third party that started this most recent discussion has done transit agency studies throughout the country, very reputable. And I think that that's something to be noted, that these are trusted advisors that have brought us multiple additional resources, and I don't see that this being any different. As stated, this most recent iteration has been really a 2-year discussion that we started the ball about 2 years ago with moving forward with that in the early stages. there was mention of having metrics and tougher metrics. I just want to note that that's already in motion. And so those metrics, regardless of whether or not there's a JPA or not, the county, we're going to have to be meeting those. And so it's going to take creativity to make sure that we're increasing fare box. So that's not something that goes away. That's something that actually I think helps us out when we have, again, economies of scale that looks at. It's been alluded to. I think that it was, even with this discussion and being in multiple and lots of different meetings about this and reading reports, I'm still learning some new things. And so one of the things that I learned today is that we don't necessarily have the building reserves or the capital replacement for TCAT. And I think that just drives the point home that we should be going to something like this. We haven't been saving up like any good business model should be doing. We do that here at the county with our reserves. And we just had a robust discussion about our countywide transportation improvement program and talking about those reserve policies. I think those are prudent, and we should also be looking at that here for transit, recognizing that there are some challenges there and that we want to put as much funding into roads. And that kind of gets me to the point of what the initial intent of this. And I think it's important to recognize where the direction is as far as what I was concerned, is that the goal would be to improve services and have additional funding for road improvements. That's always been my goal, is that how can we be more efficient and achieve road improvements? And I think it's important to note, because if this happens, then this is something that should continue to be the focus of the new organization, is that how can we get that better level of service and improve our roads to a greater degree. And if that board has that philosophy and that drive and that push, then that should be what is being achieved. Just like TCAT has a mission statement that was stated earlier, and I think that's admirable. Having something along those same lines with the new JPA helps to drive staff to achieve those results for all member agencies, not just the county. And I think that is really important to note that they would do that, because the purpose is to be more efficient with taxpayer dollars. It's not to spend more on, glamorous buses or anything just for the sake of having a nice fancy bus. It's to get more riders, to improve services, but also provide additional dollars and savings for roads, because we all know this. I mean, we've talked about this ad nauseum as far as we need better roads. We have an issue, and I appreciate all staff's doing, TCAG and Resource Management Agency is trying to provide additional resources and being creative on doing that. I think it is also important to note, and I'm glad Ted brought this up, that there's a tremendous amount of transit-only dollars out there that we can use. I think at our last TCAG meeting, we talked about the federal government through one of the COVID packages provided, I believe it was roughly 18 months worth of operational costs or something for, I could be wrong on that exact number, but it was over a year's worth of dollars as far as operation, which is why our transit providers are able to go to a no-fare system to try and help increase the cost. So just to echo what Ted said, I recognize change is difficult, but leadership is needed now to make a transformational improvement. And I really think this can be a transformational improvement, recognizing that we don't want to lose dollars, that we want to improve, and have those things. I think those are worthwhile to be a part of the discussion. And to make sure that we keep our eye on the prize.
All right, any additional comments for Ted? Thank you very much, Ted. Appreciate your insights today. Are there additional public comments from anyone here in the audience wishing to speak about this?
May I respond to a few comments?
No. Oh, yeah, sure. Of course, Ross.
I would agree with almost everything Ted said. There was no intention of trying to mislead on any representation of funding or that this was not in addition to what is available for transit-only funding. But two comments there. He is correct. The current operations contract for TCAT was about 20% higher than our previous contract, which was a lot more than we expected. But we've determined, and I don't have the exact math with me, but around 13 to 14% of that was directly a result of the increase to the minimum wage. The drivers are held at an index slightly above the minimum wage, so as that was beginning to rise very rapidly, that caused the total contract value to shoot up very high. That was the same for most of the other ones, so other than the minimum wage increase, it was around a 6 to 7% increase, which was still a little higher than we expected. City of Isalia's was substantially higher. Theirs was about 40% higher, but theirs was not the low bidder. Their low bidder was also in our 20 to 25% range. Their selection of their contractor was not based on cost alone.
Okay. Great. Any additional comments from members of the public? Any phone-in comments, Madam Clerk? No, we have none. Thank you. I appreciate all of the effort and detail that was presented here today. So thank you, RMA, and we look forward to this coming back to the board for formal action in the future. Okay, we will move on our study session now to item number 2, which is again within the RMA realm. And that is going to be a discussion of the EDC, and that presentation will discuss the county's membership with the Tulare County Economic Development Corporation. Mr. Washam.
Good afternoon. Mike Washam, RMA Associate Director. Yes, today we're going to talk a little bit about the EDC membership. I was asked to bring this forward from our CAO as it is coming up on time for next year's fiscal years. There we go. Okay. So today for consideration is just to get direction from the board. There was a change in the formula for the contribution that the RMA, or not the RMA, the county puts in to the EDC. So that formulation was adopted by the Tulare County EDC's Board of Directors back in January. And this kind of shows the change. The first column is what the current and formula had produced for many, many years, as far back as I know. And the next column was the annual contribution. And that has changed. The formula has not changed for years, but the total dollar amount has been reduced over a number of years to the current level of $227 a year. So the county was paying $44,212 the last couple of years since we've re-entered. And then now under the new formula, that the county's from a 19.4% share to 39.8%. So going forward, we'll be requested to participate at a level of $90,712, which is an increase of 105% over what we had been paying. At the same time, you can see the other jurisdictions have reductions out of this new formula as well. So that was kind of what we're at. You can look and you can see, with the exception of Dinuba's participation went up as well. So the formulation for this was developed by the County City Managers Group based on 4 factors: total population, total sales tax received, total property tax received, and total number of jobs in the community. So what they did was they took the percentage of each jurisdiction's share based on each of those 4 factors, and then they added those together and averaged it together to create the budget percentages. Again, as I mentioned, the total public sector contribution of $227 remains the same as in previous budgets. It's just the formula has changed, so different jurisdictions pay a different amount of that. And this is the chart that the EDC had in their packet, and that's showing each of the 4 variables that were used to determine the new percentages. And really, that's all I have to say. Really kind of looking at questions or anything. A couple recent things going on, obviously, is, as I mentioned when I was giving the tourism update, the COVID-19 has really wreaked havoc on our budget process going forward, so that's obviously a concern. And that a week ago Monday, the city of Farmersville had voted to remove themselves from the EDC. So those are the most current relative events that are going on. If you have any questions on anything as far as staff's participation or what you're looking at.
Yeah, if you would go ahead and stay up here, Mike. I know that board members may have comments and questions, and then we'll open it up to the public after the board is done. Supervisor Shucklian?
One quick question, Mike. What prompted the change in the formula?
Excuse me. Well, I'm not completely privy to it, but we have a history of the EDC. The county pulled out back in 2013-14 because the Board of Supervisors at that time didn't feel they were getting a return on investment. And then we pulled out for a couple of years, and then we did come back in, but at the time we came back in 2000, it was either fall of 17 or 18, I think 17, there was a lot of turmoil going on again. City of Visalia was about to pull out. Dinuba was not in it. City of Tulare was not in it. There was some smaller cities that weren't able to afford. They wanted to be in it, but they just didn't have the money to pay. So we were kind of in a turmoil at that point, a little over 2 years, or about 2 years ago. And the county chose to come back in and has participated in the last couple of years.
Question that I have for you, Mike. Would you please let me know, or just make a comment on the record as to the structure of EDCs in some other jurisdictions? I mean, is this model that we have in Tulare County the only model for EDC operation in county land?
Well, no, there's multiple models. This is, it's actually a public partnership in a sense. However, the private side is only paying about, my calculations, around 10% of the annual participation membership dues, so to speak. That has changed over the course of the years. Back right before we pulled out, it was more balanced. It was about 38% private, 62% public, and then it's gradually reduced and kind of gotten to the place where now it's almost totally funded by the public sector. There are other models. You have totally private that can be driven by the utility companies and the banks and all of that, which a lot of models are like that. And then there's the totally public sector too. There's ones that are just part of a government jurisdiction that has their own agencies set up specifically. So there's a wide gamut. Now, when we were talking back in 2017, when we were coming back in, there was some communication, and actually they came, Kobe Wells and Paul came to the board, made a presentation, and there was talk about we're going to grow the private side to try to get more private side investment. So far that hasn't occurred, so.
Okay, thank you. Any additional questions or comments from board members at this time? Okay, seeing none, I will open it up for public comment. Any member of the public like to come up and speak to this item? Mr. Saldana, thank you for coming here today.
Thank you, Mr. Chairman, members of the board. Just to address a couple of the questions that came up. I don't really have any comments unless there's questions. To Supervisor Shucklian's question about the proposed change, when the formula that Mike showed was adopted back in the 2016-17 fiscal year, the board adopted it for 3 years. And so it was a 3-year cycle that caused the formula to be reviewed this fiscal year to take effect in 2021. So that was on the basis of that, on why the formula was done. And then the second question, in terms of the private sector contributions that Mike had mentioned, we did We have had an increase in private sector contributions to the overall economic development program. They're just not coming into the EDC's budget directly. They're going into a private foundation that we set up to basically continue to manage the programs that the board wanted to continue but did not want to fund with public dollars. And so that has increased, and it continues to increase each year. So that's a result of the shift of the dollars as well. So with that, I'd be happy to answer any questions that the board
Any further
has.
questions or comments from board
No,
members?
can we put that back up, the last graph that was up there? Thanks. All right.
Okay, go ahead, Supervisor Townsend.
There we go. So you answered, Paul, why why it came back up, because it was on a 3-year cycle, so it was time for it to come back up for review. Why did it change so drastically to put the lion's share on the county and to reduce the share to the cities?
That was a decision of the city county managers group. So I can't address that specifically. They looked at, I think there was 7 or 8 different options that were considered, and this is the option that they chose. And under our current structure, whatever that group recommends to the board has typically adopted.
Okay, and you're not sure what their thought process was?
I think the one
County
person that was
administrator
there,
could
he
probably
can make-
better
make a
address that.
comment on that.
Right.
Supervisor. So essentially, yeah, I mean, the formula did go through the city managers group a number of times, and this is sort of where it landed. However, I do have to say that I'm not sure exactly how many times we sent Paul back to the drawing board, but each time it did not change significantly. I mean, whether we used metrics of jobs in the community or labor force or, a number of different formulas, the dollar amount at the end of the day did not change significantly. This formula, I believe, resulted in about $3,000 or $4,000 less for the county, but it was not significant.
Less than other formulas, but not less than the last.
But not-
What was the big deal for the new formula? What was the thought process to change the formula where the county would come up with a 100% increase?
I mean, I think that would be I know his admin committee has a certain budget they adopt and certain things. Essentially, the previous dollar amount that we were paying, the 46,000, was a reduced sort of subsidized amount to entice the county and other jurisdictions to return to the EDC membership. I think at the time we joined, it was not clear whether that membership fee would continue, but clearly through our discussions that did not, and so now they're sort of going back to the way it was. So, it's kind of similar to the transit discussion we just had. We, instead of trying to reimagine something new and go forward and make it palatable for everyone, we kind of just went back to what we knew. That's my opinion.
Provide some clarity there and a little bit of a background. So prior to the county leaving the EDC, the formula was based off of population and sales tax revenue. So those were the two metrics that were used for the formula on a rolling basis. It was typically every 3 years. When the county left, so the county is now out of the picture, the group decided to add property tax revenue basically into the mix, and then redistribute the EDC's budget on the basis of that new formula, and then take whatever the county's piece out, and then everybody would pay whatever was remaining. And so that factor was included, but the dollar amount that the county would have contributed had they been a member was not. So when the county came back in, what we decided to do, the board decided to do, was factor the county back in, not put them in at that level, which would have been somewhere around $120,000 or something, but put them back in at a proportional level to what they were contributing prior to leaving. So the current amount is based on that, is based on a proportional level of what the county is contributing prior to leaving. So there's kind of two things at work in that current, in the way it's currently distributed.
Did it come up in conversation at all that that's why the county left in the first place? So this could happen, that it could be a problem again?
Yeah, I mean, I sit in a city manager group of 9, and we all have one vote. And, I raised the issue several times. Paul was there about, I don't think this is going to be palatable to the board. We just came back in. Now we're turning around less than just a couple of months, and we're changing the formula and asking the county to pay and decreasing the city's contributions. Again, there was considerable discussion about that. I mean, I think if you ask the city managers to just have a fair representation, they'll say, well, yeah, but the county gets the majority of the property tax. If economic development happens anywhere in the county, the county benefits. I mean, that's sort of their position. And they are correct I would question, or I would ask, to what extent we benefit, because there is sharing agreements for revenue with the cities. And services, and depending on where that development lands. And so I'm sure Mr. Washman can speak to that much better than I can. But so, yeah, there was a lot of debate. Again, I mean, the city managers group did send Paul back to the drawing board a number of times. This ultimately was the formula that was voted upon. And I don't know if Mike, what was our fees before we dropped out?
Can I ask a real quick question to clarify? Because Paul, what I heard you say was this formula was already decided when we came back in. Is that what I heard you say? And then we came back in at a discounted rate that everybody got because people were wanting to leave. But what I heard you say was this was already voted on when we came back in, and then it just happened to take effect later. Is that what I heard?
No, I'm sorry
Okay.
if I was confusing in that.
Yeah.
The formula was in place for the way the city's portion was distributed after the county left. So when the county came back in, that was where we basically prorated the amount based off of what your prior contribution was. So it wasn't that this was in place only for the cities as they were contributing. And you're correct in pointing out that there was the budget when that was created, the budget was much higher, the public sector share was much higher, and that has been discounted, or that has been dropped about 56% over the last 2 years.
And all of the jurisdictions got that discounted formula, correct?
Yes.
And when the county pulled out in 13, 14, did the burden fall then on the jurisdictions of what the county was paying? Because that was mentioned someone mentioned that during the phone one time, that everybody took our burden because we left, but that wasn't the case, correct?
There was a redistribution of a portion of that, but it wasn't an entire, I believe I don't know if Mike recalls what the county was contributing at the time.
Okay.
But there was only a portion of that was redistributed when we updated the formula, because again, we updated it without the county, but we also increased our budget at that time, so.
Okay, additional questions or comments?
Not yet.
Anything else, Mike? I would just, I'll just make a comment. I think that, Mike, you touched on a little bit of the, one of the issues that I wanted to raise. I think that, obviously I've been on the board since 2009, and there have been different issues with the EDC that have been brought up since that time. And one of the consistents has been a desire to shift the funding responsibility to more of the private sector. And it seems like that's been indicated to us that it was going to shift to the private sector. It was, here's the plan, this is going to happen, and it really doesn't. And I made a comment in the TCAG, or the Consolidated Transit item, talking about the weighting of the vote. And you look at this, and and how much the county would be contributing here based on this current methodology. And the county's contribution is, significant, but yet the vote of a jurisdiction that's, paying $2,000 is worth the same as a jurisdiction that's paying $90. I just don't know. I think there's tremendous benefit in a county-wide economic development effort, but I feel like we keep trying, we keep putting forth an effort to change the funding, to revamp the funding, to advance economic development in the county, and we keep coming back to the same place. So I think that we have to, I want to have a formal decision set for the county's participation, a thumbs up or thumbs down, prior to the start of the EDC's fiscal year, so that whatever decision is made, the EDC is given adequate time to budget and formulate what they're going to be doing moving forward. So I just ask that that be something that's brought back in an expeditious fashion, so that this board can give direction one way or the other. And I see Supervisor Crocker wants to make a comment as well. Go ahead, Supervisor.
Yeah, thank you, Mr. Chair. Just few things from the past, because we did have this discussion 3 years ago, I believe, as far as whether or not to rejoin. And some of the comments that I made, and there was hesitancy on my part on doing that, is that one, I wanted to make sure that we didn't have overlapping services and that we were having additional benefits. And so that needs to be, I think, part of the discussion if this comes back. What does that look like as far as, are those tangible benefits? Are we seeing, some type of tangible benefits? And I think the cost-benefit analysis still, it still is relevant today, even as it was when talking about doing that before. I was in favor of rejoining at a reduced rate, and I think we basically kind of said what we thought would be a decent rate, and I think it was even less than what we're paying now. That it was, I think, $20,000 or something. Rings a bell or something.
First came in at 10,000 as a non-voting.
Right.
And then it went up to 40-some thousand, I believe, as a voting member.
But even there, though, with the initial dollar amount, we did get. It wasn't a requirement that we had a voting position, but that was extended to us, correct? That's correct. Yeah, so it was, and I know that was a suggestion to say if we wanted to make this a partnership, then even though it wouldn't be, because we wouldn't be a full member, that would still be an offer, and the EDC did offer that for us. I think, again, from my perspective, it was more along the lines of, out of solidarity and trying to help some of our small cities and doing something together. Since that happened, I know there's multiple cities have had very serious discussions about leaving or have left. And I believe Tulare, in addition to Farmersville, Tulare, is that correct, is not a part of the EDC?
Tulare is a member.
Though they are a member,
Yes.
Okay. So again, it's just, that changes the dynamic for me, though, as far as whether or not individual cities are part of it, or just the fluctuation, the stability. Because again, I think there's less benefit for providing some of those things. And I guess I just state that I appreciate Supervisor Shucklin's leadership on this committee, on this group, and I would say that I would be interested, if we're going to have this another discussion, just what her thoughts are, or staff, as far as the benefit. If we are finding benefits, then I think that's it's worthwhile. But if we really think that the benefits are there, but at what cost, right? That's really going to be the question. Can we use these additional dollars elsewhere? We just took a very tough action for a hiring freeze, and so to have any type of additional cost increases, it's taken with a new light today. It's not the same situation that we were in February.
All right, Supervisor Shucklin.
All right, I'll make my comments now. As most of us know, I was a very strong proponent of coming back into the EDC when I got onto the board. I know Chairman Vanderpool and Supervisor Crocker were also willing, and I think we did it as a good faith effort to show that, it's important to have a unified force and partnership with all of the cities and the EDC when businesses are coming or looking to come into Tulare County to have the county be a part of that, I thought was very important. As we just said, we came in at $10,000 as a non-voting member. It increased to a voting member. But my reaction at that meeting when they showed this up on the screen was like, whoa, wait a minute. We're doubling when others, jurisdictions are going down, 30,000 and 7,000 and all of that. And I just said, I don't know where my board is going to be on this, my colleagues. We had a meeting last week. I know we talked a little bit about maybe changing the governance structure if we're going to be paying more. I'm not sure I necessarily agree with that because I don't really know what votes that the EDC makes that, we would have to be worried about, more cities outvoting us that have a smaller percentage or a smaller price to pay to being a member. So that's not so much my concern. It's just basically the cost and the doubling of the cost. And, we keep hearing, Mike, you're at those meetings, everybody hears, well, we heard, the county's holding a gun to our head. Well, what's this? What's being held to our head when we're getting a 100% increase? Sounds like, a tank is being held to our head. Again, I've always been supportive. I keep hearing, well, when something gets built in one of the cities, the county prospers. When something gets built in the county, cities prosper. Whether it's somebody buying a home or spending the money in the cities, providing the services that we provide. So, again, as somebody who was a very strong proponent of coming back into the EDC, at this rate, I can't support being in the EDC anymore with this formula and us having to pay this amount. And again, partly, we were doing pretty well on our own. I know we came back because there were some services that we sought outside of the EDC and thought, well, the EDC provides those, so we can give our business to the EDC. But it's not coming out. It's not being cost effective to me. So that's where I'm at.
Okay, well,
Before,
go ahead,
may I
Mike.
make a statement, or Paul, you can go ahead.
I just wanted to just clarify for the board that the reason that we're here, the reason that we're having this discussion is that in our bylaws, the way the organization is structured, we basically take our budget, which is this 227,706, which is our base operating budget, and under our bylaws, it's distributed to the public sector on the basis of a formula. That is the structural roadblock that the organization has faced for a number of years. As the chairman noted, in terms of the private sector, we have increased that. In fact, at one point we had about $170,000 in private sector dollars that were coming in. But then because we had to decrease those programs, we also lost the funding that went along with those programs, and we're back to this percentage of the public sector paying a lion's share. That's based off of of our bylaws, and I think that is one of the issues that our chairman has mentioned at our last meeting when we had the discussion about governance that needs to be addressed, because if that is removed from there, then there's a lot more flexibility in terms of what percentage of the budget the public sector pays, what the formula looks like, and all of those sorts of things.
Thank you.
Yeah, thank you. I totally agree with that, because the one constant has been the various jurisdictions having concerns with their participation for whatever reason. Small cities are looking for different things from the EDC than the big cities are looking for, and it's hard to try to fit everything into that. And when that's the controlling budget and the controlling vote, it becomes a challenge to be efficient. So we've looked at a decade of struggling through this constantly and revising and reinventing and stuff. I really think, personally, I think the time is to look at those bylaws, figure out a different way to organize that. The county certainly wants to participate in this. It's a county-wide effort. It's whatever level that is, whatever that looks like. But Paul's under these pressures from every jurisdiction wanting something different, and it's a challenge. And there's limitations on when it's a publicly funded board or budget, that what they can and cannot do. So I think that, you know, if we'll make a recommendation, but I think changing those would help a lot. Restructure the whole organization. I'll tell you, the things that we do, they've worked well with the countywide initiatives, like when we did the Opportunity Zone, coordinating the cities on that, previously the Enterprise Zone, and those types of things, and currently the effort to try to put a not Facebook, but their website for the COVID-19 biz response. So those are great things. We want that. We definitely want that. We want to be a team player. And I've talked to the city of Farmersville, and they're even though they pulled out, they understand our position as well. And we're moving forward to that. But I just think that it's enough. We've been struggling with this for so long that the solution is kind of rebuilding the guts of it, and then moving forward.
I have another comment. Something that, you know, doesn't sit real well with me is, I believe the admin committee are all made up of the private enterprise members. Is that correct?
That's correct, yeah. There's
And then
one
this new
vacancy.
recovery task force, again, it's all private. The cities and the county are the biggest contributors, yet we have nobody who sits on the administrative committee, and nobody was asked to be a part of the recovery task force. So again, we're paying all this money, where is our return on investment?
Well, in terms of the admin committee, I could address both of those, but in terms of the admin committee, the admin committee and the chair had asked on a number of occasions for a public sector involvement in that. We've had a vacancy since Teresa Boyce from the city of Exeter served in that position, and so there is a public sector position available on the admin committee. We've not.
It's been empty for, that's the first I've heard, it's been empty for 3 years?
Yes.
Well, again, that's a problem. If you can't get it filled, or I don't recall it being announced at any meetings or anything.
Okay.
I'm done.
All right, well, I think you have direction to bring back an agenda item considering the county's membership at a future, soon, upcoming agenda. Any last comments or questions from members of the board? Any public comments? Madam Clerk, any phone comments? Okay. That does conclude our study session now. Thank you, everyone, for participating and being patient. Council, do we have need for closed session at this time?
Yes, we do have need for closed session at this time. Item D is off calendar and will take up the balance of the closed session agenda. We do have one announcement out.
Okay, great. Thank you very much. We will adjourn all open session proceedings into closed session. Thank you.
Oh, we're going to come back.
We'll come right back.
Jennifer Flores reporting for closed session item B. The Board of Supervisors directed legal counsel to seek appellate review or relief in the case of BNSF Railway Company versus Alameda County et al., U.S. District Court, Northern District of California, case number 4:19-CV-07230-HSG. The adverse party is BNSF Railway Company. This case involves unitary property tax as applied to the railroad property. The roll call vote was on motion by Supervisor Crocker, seconded by Supervisor Dennis Townsend. The motion was approved unanimously. This concludes reporting out for today's closed session.